morning, everyone. We're going to call the special meeting of the Carson City Board of Supervisors to order, and also the Carson City Board of Health to order. Today is Thursday, August 28, 2014. It is just about 30 seconds before 8:30 a.m. We're in the community center at the Sierra Room, 851 East William Street. Alan, can we have a roll call? And at the same time, do you want to introduce who's with you, please?
Yes, thank you, Mr. Mayor. Introduction, Ms. Sue Merriweather, who will be the clerk recorder on January 5th, and so she's going to join us once in a while between now and then, so be nice to her. Supervisor Ray Bowden. Here. Supervisor Bunkowski. Here. Supervisor McKenna. Here. Supervisor Shirk. Here. Mayor Kroll. Here. You have a quorum present of the Board of Supervisors, Mr. Mayor.
Thank you very much. Would you please join me in the Pledge of Allegiance?
To the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for
all. We're now on item number 4, public comment. This is the time to comment, if any, on a topic that is relevant to or within the authority of the Board of Supervisors at this juncture. Anybody? I don't see anyone. Okay. We'll go to item 5, the agenda. Anybody have any changes to the agenda? We okay, Nick?
No changes, Mr. Mayor.
Okay. I have a 2:00 appointment back at City Hall.
I'm not going to take that long.
Okay. Well, I was going to say if that happens, I may want to move some of the action items around and take the information items so I can kind of make that meeting. But hopefully we won't have to do that. Okay. Unless there's an objection, we'll take the agenda as published. We'll now recess at the Board of Supervisors, and we're going to have Dr. Pintar call us to order as the Board of Health.
Thanks. All right, now that's with authority. That's with authority. Thank you. Thank you. I know you do. You have to keep poking my...
Roll call.
Roll call, please.
Member Furlong.
Here.
Member Abound.
Here.
Member Bunkowski.
Here.
Member Kroll.
Here.
Member McKenna.
Here.
Member Shirk.
Here.
Chair Pintar.
Here.
You have a quorum present, Madam Chairman.
Thank you. I will entertain public comment on any Board of Health matters. Seeing none, I will ask for approval of the minutes of March 6th, 2014, which were included in your packet.
I move to approve the minutes for March 6, 2014 as published.
I second.
A motion and second has been made to approve the minutes of March 6th, 2014. All in favor, aye.
Aye.
Those opposed? Thank you. Motion passed. I will go on to item 10A, which is my report as the health officer for Carson City. I have kind of a good news, bad news report today. The good news is, as you may have heard, the state came through with funding, actually total funding, for our flu vaccine pod exercise. So that I have to give a lot of thanks to Kathy Bartos, who will be here later on in the meeting, for lighting a fire under particular persons, and also thanks to the state public health, public and behavioral health, Dr. Tracy Green, for finding the funding. We anticipate having the flu/pod meaning point of dispensing exercise, which, as you know, is a preparedness exercise. We plan on having this exercise in late October. We're thinking about possibly having it on a Friday afternoon evening as opposed to a Saturday. And I would welcome any comments, either now or under public comment, as to what you think. The idea is not only to get our citizenry vaccinated, but also to practice for the event of an emergency. And so we have never done, to my knowledge, a Friday evening or any weekday evening type of exercise. We thought it might be interesting to see how we could all work together at a different time of day. The second part, or the middle part, is neither good nor bad news. It's decent news. I did go to the NALBO conference, the National Association of Local Boards of Health, that was held in Milwaukee, an interesting town. They had a number of presentations on the 6 functions of public health governance, and there is a handout available that talks about those 6 functions. I wanted to go briefly through some of the things that we are doing, just to remind you, and also as a little bit of a warm-up for our accreditation visit, which will be in about 8 months, I believe. Anyway, so under policy development, that's really one of the largest charges of this board, is that we are asked to develop good public health policy. There are some opportunities that will be coming up. One of them, Karen and I will talk about a little bit later. Under resource stewardship, I think that this arguably is number one on most people's minds. A subcommittee with Mr. Bunkowski, sorry, Mr. Bunkowski, Nikki Aker and myself has recently been formed, and our charge is to look at all the funding sources and programs within the health department, analyze which ones are sustainable, analyze which ones are most valuable, and consider, do we need a certain program, and what other programs do we need, and look at some of the funding sources for that. So it's not just going to be the 3 of us making that decision, but we will be spearheading the presentation and asking for input from the rest of the Board of Health as well as the community on that issue. Legal authority is another part of the Board of Health, and that is where we come under some of the city codes that are made. For example, the animal code, which may well be moved out, but reporting of infectious disease and things like that. Partner engagement to me is a very important part of our job as a Board of Health. And what I would expect from all of us is an active effort to go out into the community and ask about items of public health interest. I think too often we sit here as a receiving authority in the sense that we receive information, but I think we all need to be more proactive in going out to the committee. And I have to give a pat on the back to the mayor for mentioning this at the Rotary meeting and getting a little press for that. I appreciate it.
Well, yeah, and oddly enough, I also told the Rotarians that, we were having difficulty finding the money for the flu vaccination, and that we were looking for clubs to kind of help out, with raising it. So you crossed that bridge admirably.
Cross that path. Well, but having said that, I think that those are the kinds of issues. It's not likely we'll get the money again. So, we may face the same thing next year. But there are a number of public health issues out there that the community service clubs and other community partners can help us with. And we want them to help us with. We don't have that ability to do those things on our own. Continuous improvement is another of the functions of a active Board of Health. And again, it's some of it, we will hear some quality improvement projects that the health department is undertaking, but we also have to keep in mind, where do we see room for improvement within the public health system throughout the city government? Parks and Rec, for example, they help us post the signs that say no smoking in the parks. That's a public health effort, so it's not just limited to what the health department does. And then last but certainly not least is our oversight, and that I think encompasses many of the projects, many of the things that we do. What are we always, as the Board of Health, looking to see that we are providing the best possible service in the public health arena to our citizens? And I will finish up with what I consider the bad news. About a year ago, I came to this board with a report on some of the sexual assault statistics that had been reported within our county. We have a SART team, Sexual Assault Response Team, which is composed of the Sheriff's Office, Advocates to End Domestic Violence, the District Attorney's Office, the hospital, and the public and the health department, and I chair it. Unfortunately, the bad news is that we were recently notified that Carson City Hospital will no longer provide exams for victims of sexual assault. This is unfortunate on many respects, and Sheriff, if you have any comments that you want to chime in. The biggest one, obviously, is for victims. It has been a challenge for the hospital to maintain staffing in this arena because the nurses do require special training. But one of the very upsetting things for a victim is that if they present to the hospital and they're now told, no, I'm sorry, we don't do that, you'll have to drive to Reno. And that, I think, cuts at the heart of trying to provide service to somebody who is in a very vulnerable and scared position. The second is, frankly, is an effect on our public agencies. The sheriffs will have to take the brunt of getting those folks up to Reno, sitting there with them. I mean, that's probably a 6 or 8 hour round trip that is relatively, from that perspective, unproductive. And then the support services, such as advocates, which runs the SARA program, and others, are also affected because of the delay in access to the victims, as well as, for example, the district attorney's office is likely to get fewer complaints because fewer people will be willing to take that first step, travel out of the area, and make the complaint. And quite frankly, we've had I think, an impressive increase in the past few years in successfully prosecuted cases for sexual assault. So that's the bad news. I guess what Supervisor About and I and City Manager will be meeting and coming up with a bit of an action plan, trying to involve the hospital to see, are there any strategies that we can use to get those services back in Carson City. We do have a backup plan. There is a what's called a CARES program in Washoe County that is actually paid for by Washoe County, where they will accept our victims of sexual assault for exam. We don't know how long that largesse will last. As you can imagine, once Washoe County figures that they're serving all of northern Nevada, they may not be quite as generous with their resources.
I thought I understood that the training, that the Attorney General's office provides free training.
They do.
For nurses.
They do.
Okay, I'm sorry.
Yes. So I don't believe the expense is in training as much as other expenses that they believe. John?
When the group discusses it and brings it forward, if you could bring it forward to the board as part of, is this part of the law enforcement function, having this nurse available, having this function available at our hospital? It seems like if it's going to tie up sheriff's deputies for many hours, then it might be, we need to reach some accommodation with the hospital, even if it ends up costing the sheriff's budget some money, so.
Well, I appreciate your gesture. Dr. Pinter is very, very right. This has been a challenge for well over a decade. And the sad part about it is we're talking about the treatment of victims who have been just extraordinarily traumatized. It's not so much it's the tying up of the resources, it's the treatment of our people that live right here in the town. And some, you know, I'll say it out loud, I might as well be the one, I know you, we treat inmates better.
That's because we're on Medicaid, but the thing is, though, it's, you mentioned it's a problem that's been here for a decade. You have, and I try to take all sides on this particular matter because the hospital, like it or not, is a business, and they are struggling, and they have to watch their bottom line and what services they provide and what services they can make money for. and I understand that. But it is a community problem that needs to be solved, and I would prefer we arrive at a solution that's long-term and that everybody can live with. And if it costs us more money into the law enforcement or into the public safety budget, then we'll put more money in the public safety budget.
If I could add a little bit, while financial resources were part of the problem, I don't believe that they were the biggest issue in this discontinuation of services. There are other issues at play.
Well, last time I heard this was a year or maybe 2 years ago, and the problem was that the nurse had special training, and they had to pay that person more, and they had to have, for availability, they had to have a couple of them, and they could get.
Yeah, there's some parts of that is true. The hospital is reimbursed for each exam that's performed, and actually the current rate of reimbursement is 2.5 times that is provided to Washoe County. So anyway, there are a number of details that I don't think we need to dwell on. The major problem to me is that this is a discontinuation of services that I feel is very necessary for our community.
And Susan, I'd just like to echo the fact that because our hospital is a regional hospital, and also with our cross-jurisdictional sharing that goes on with Douglas County, it's really important that we're able to provide this service. So it may be an opportunity to make this a better service. So I think it's going to bring the conversation to the forefront, and that's what's important.
Susan, I think it's great that you're setting up a committee to meet to see what can be discussed in future plans. I would also like to open the door, the opportunity that another board member may also serve on this, because we could have 2 on there. So when these things come up, maybe if we could allow all board members to participate in these things as they come forward, not
Certainly.
this one in particular, but everything forthcoming in the future would be great. And if any board member would like to serve on this, that'd be great. And
Certainly.
I volunteer my name. I don't know anybody other board member would.
All right. Well, and that certainly, Brad brought that up to me also about what we're calling the Resource Stewardship Committee, is that, and that was my mistake, because I thought that there could only be 2, but there could actually be 3. So if somebody's interested in taking the load off Mr. Bonkowski and I, we would not complain too loudly.
How many are on this board? 7.
Yeah, I'm not
7, you can
Seven.
have 3 then.
So we can have 3, right?
Yep.
Okay.
May I make a comment on the SART?
Please.
So the sheriff and I have been working on this for 8 years since I got elected, and to his credit, Captain Sandage has been very involved.
Assistant Sheriff Sandage.
Oh, okay, I didn't realize, sorry. So I can't call him Cap anymore. That sounds probably weird to him. All right, well, anyway. So Assistant Sheriff Sandage and I have been involved, and the issue is not money at all. The issue is quite simply the hospital who received a bunch of money to have a SART room built for this exact purpose, because these victims are not transported to Reno. They're transported to Sparks, and it's far in Sparks. This is not, the tip of Sparks. This is an hour commute minimum. Oftentimes, they don't want to drive with these guys because they're afraid, so they drive with their family members, which immediately the defense bar stands up and says, well, how do I know evidence isn't being spoiled as this person is driving? Because at this point, their body is considered evidence, which is sad in and of itself. And the hospital refuses, and I've sat down with Ed Epperson and Mike Pavlakis at lunch, and they refuse to back this program. And I'll just call it the way it is, and that's where it's at. We had 6 SART nurses trained for Carson City, and all 6 of them volunteered, went to this training. It was paid for by him, by the city, and they all disappeared because they don't get called, because it's too expensive for the hospital to have to deal with their manning. But yet he sits there and he's willing to pay for this. They just don't want to deal with it. And so until somebody gets the political will to look them in the eye and say it's time to deal with it, they're not going to. And that's where it's at. And I think you would agree, is that where it's at?
Yes.
So, we pay plenty of money, and we have plenty of resources for this program.
Is this a Board of Health issue or a Supervisors issue?
Probably both. Probably both.
Okay. Do we want to put it on?
Well, I would suggest that it stay Board of Health initially, because otherwise I don't have any authority in it.
Okay.
And you know how pleasant I can be.
I would suggest if you are forming a subcommittee to talk to the hospital, since it may be a Board of Supervisor issue, you only put 2 supervisors on there.
Thank you. I appreciate your comments and your support. We will go forth. Are there any, let's see, I don't ask for public comment. Yes, I guess I ask for, I would ask for acceptance of the report and possible direction at this point.
I move to accept the health officer's report and give direction to staff on CCHHS activities, to include a meeting arranged with the city manager, 2 supervisors, and Susan Pintar as director with the hospital staff.
Second.
Motion and second have been made. All those in favor?
Aye.
Those opposed? Thank you. And now we'll go on to item 10B, which is the report, discussion, possible action regarding the activities at Carson City Health and Human Services. Nikki?
Good morning. So this is my director's report, and I'm going to start out with Human Services. And you can see my slides up here. So this is what I want to start with, is the workforce development program that Lynn Ellis heads, and I'll introduce her in just a little bit here. But during fiscal year 2014, through her program, there were 70 individuals who found jobs. And of those 70 individuals, 59 of those jobs were located in Carson City, and 11 were located in Mound House, Genoa, Minden, Reno, or Virginia City. So, and these numbers do not include those from the job fairs. This is just through her program, and she does a weekly class for individuals within this program. During fiscal year 14, also through these classes that she heads, there were 446 participants, which is an average of 9.7 per week. So you can see she's pretty busy with that.
Thank you, Lynn.
And now I'll take this opportunity to introduce Lynn Ellis. And we've got a job fair coming up on September 26th, and she can come up and tell a little bit about it.
Thank you. Good morning. Well, we've been preparing for the job fair. My partners and co-hosts are Join Job Opportunities in Nevada and Ronnie Hanneman in the Chamber of Commerce. And this will be our 5th job fair that we've held together. So far to date, we have 40 employers and resources are SVP'd for this event, and we still have 4 more weeks until the event. So I'm expecting that we get somewhere near 50 employers and resources. It's manufacturing, retail, hospitality, healthcare, armed services. And at this fair, for the first time, we're going to open the doors a little bit early and let veterans come in at 1:30 and open the doors to the public at 2 o'clock. They're really great events, and I'd love to invite you all to attend. They really are great. They're great for our community. The employers get very excited about them, and they've been pretty successful. Last year, I think 146 people got jobs just from attending the job fairs, the 3 job fairs that we held last year. And in February, we had a fair this year, and 49 people obtained jobs from attending that fair. So they're really great events. They're right here in the large gym at the community center. I also take on individual clients. I create resumes, teach them how to interview, and really strongly work with these clients on work ethics. and removing barriers they have, keeping a job, holding a job. You know, we have different things that we deal with here in Carson City, seasonal positions and things like that. But this year so far, it's just really been an outstanding year. Employers are hiring, we have growth here, more opportunity, and so it's just getting better and better.
Good morning, Lynn. Question
morning.
for you on your classes, if we can go back to that. You had 446 participants, 70 found jobs. That's approximately 15%. I'm just curious how that compares to previous years. Do you think that's higher or lower?
From what I've seen for my predecessor, I think, I do believe so, from the program from 2012 and forward. I don't have exact numbers on that. I started in this position in February of 2013. So I've really been doing tracking from that point forward.
At some point in the future, if it's possible to put those numbers together, just so we can see the trending on it. I'm just curious how the program's been working overall, and it's hard to determine that from one report. So it'd be nice to see over a period of time how that program's been working. Because 15% might be exceptional, it might be average, you know, I just don't know. So thank you.
Okay, thank you, Brad.
Supervisor Bonkowski, you can see on the previous slide, the workforce program assistance. It has numbers back to June 2012, and you can see that trend line is doing a steady incline. So if that helps at all.
I think the other thing is that Lynn's expertise here has really improved the program at the department dramatically. There was not, as to my recollection, a dedicated workforce development position. It was there, but it was not as dedicated as Lynn's hours are.
Thank you, Susan.
Thank you, Lynn.
Thank you very much.
Oh, yes.
Just so we have an idea of how the health department is funded, could you just, this position and all the positions, could you tell us how they're funded when they come up?
How they're funded when they come up?
Yes, is this a grant funded versus a permanent program, that sort of thing?
This is a grant funded, yes.
The reason I ask that is it came up a question at Rotary yesterday that health, and the answer that the mayor gave, which was correct as far as I know, was that the health department is about 75% grant funded.
Mm-hmm.
And the community needs to know that because, you know, it's their health department.
Correct.
And if I could insert, that's one of the big reasons why the resource stewardship subcommittee will be formed, because I think that those are the kinds of facts, so to speak, that need more public awareness.
Mm-hmm. And that information was also included in an annual report and will be continued to be reported out to the community. Okay, we'll move on to the Clinical Services Division. I just wanted to share with you all, so we've gone electronic. These are some ads that have been placed on Facebook. And I just want to share a little bit about the number of some of these ads that have, the number of people they have reached. So you can see this one, the first one that starts with 9 months. So this ad reached 6,317 people. And you know on Facebook how quickly they reach others. This other ad that was on here, we just had posted on there. It wasn't a ad that we had put on Facebook. So I don't have numbers that reached. And the one here that starts, it's the second ad that says really. That ad reached 18,602 people. Oh no. Uh-oh, what's happening? Oh no. Oh, there we go. Okay. Okay, and then our back to school. Uh-oh. Technology's nice, but is that what's happening? Okay. Okay, this back to school ad, that one reached 5,407 people. So, and these ads, you do pay a minimal amount for some of these ads. And so like the one that reached 18,000, that ad ended up costing us $135. So you can see, you know, it's very minimal for the number of people that it reaches. Okay, environmental health. This is, I don't know what's going on. Okay, I'll go ahead and it will flip back to theirs shortly, I hope. There we go. We put out a customer satisfaction survey with our partnership with Douglas County on the environmental health. And what this one is, it was put out to the business owners of Douglas County. We did 2 surveys to Douglas County, and one of the surveys included Carson City, but we did the business owners, restaurant owners in Douglas County. We did a customer service survey to them. And then our second one was to the employees of Carson City and Douglas County that were involved in the project. The information that you're seeing here was to the business owners or restaurant owners. And we did get, it was a pretty low participation rate, which some of these surveys are, but it was also really new in the process. We will be doing another one come fall, as more people have been inspected in that. So hopefully we'll get a little bit higher of a participation rate. These surveys are sent out individually. They're sent out through the mail or SurveyMonkey. We do not take the surveys out when we do an inspection. And we have also made the decision not to put them out with the bills. So we want to... So as you can see, 74% either agreed or strongly agreed. And we, on these that strongly disagreed or disagree, we were making an assumption. We can't really figure out exactly, they didn't leave comments or anything, but we're making an assumption that they either didn't understand the survey or they hadn't been surveyed yet. So we'll see how these pan out with the other surveys.
When you get a strongly disagree, do you follow up?
If we can. We don't always have a name or anything. You know, some people send them on without names, but oh yeah, we would try and definitely follow up.
How many, out of this percentages, what is the number of response? Is that 100, 200?
Oh no, let's see, let me ask if Dustin remembers. It was 35.
35. And Dustin, what's the total number of inspected facilities? I'm sorry, this is Dustin Booth, who's the division manager for EPI.
For the record, Dustin Booth, Carson City Health and Human Services. In Douglas County, there's about 250 physical sites, so we sent 1 survey per site. But the actual number of inspections or permitted establishments is around 600. So we sent about 250 surveys out, had 35 respond back, and those were the results.
And like I reported, we had a low participation rate, so we are going to do this again. So, and continue to do it. Okay, on the epidemiological program, this is also headed by Dustin, and what I've got to show you is the chlamydia rates in Carson City. And, you know, looking at this, you can see that it looks like we're on a slight rise. We are not really sure, is this because there's more screening being done in the community, which is highly possible, which, at this time, we're trying to research exactly why we see this slight increase. Or is it increasing because people now have access to insurance and they're going to get medical help, through the ACA? So again, we're researching more into this, but one thing to note here particularly is you can see the bar graph on your left, and Carson City is still below the state and national levels. And this is from our public health emergency preparedness, and as you can see, there's many different things listed on here. Particular, what I want to note is we had sponsorship and we participated in the mental health first aid training. From the health department, there were probably 5 or 6 people that have participated. There is some more trainings that are coming up. So, and then we also we reviewed the continuity of operations planning, or the COOP, and I don't see it listed on, yeah, I see it listed on there. This was for skilled nursing and assisted living facilities, and that's as part of the Regional Healthcare Facility Preparedness Work Group. What this is facilities, they identify essential functions and ensure that those functions can be continued through an event or can be resumed rapidly after the disruption of normal activity. So, so that plan was looked at. And then events that we participate in, we had the first aid booth at Carson Valley Days, was on the planning team, and presentations at the Rural Health Preparedness Summit in Fallon, the MRC First Aid and Health Department and WIC booths at the NV 150 Fair. So, and the WIC booth went over really well with parents with, little kids. We had a diaper changing station there, and even had some moms come for breastfeeding, and so it went over well. And the health department participated in Story County's National Night Out. They were able to still have their event, so we participated in that. And these are the coalitions and partnerships that we have participated in the last couple months. And I'll let you guys read through that. I'm not going to read the bullet points for you. And my wheel's spinning, so. This is the immunization billing and school-located vaccination program. And
Which is a grant-supported, when it reappears, it is grant-supported.
Yes, yeah, it's a CDC grant that we get through the state. So we have completed credentialing of the APRNs and the health officers for various insurance contracts, and those are those 18 insurance contracts that we have in place to provide services and get reimbursement through the insurance companies. We finalized our immunization billing toolkit, and that was a grant deliverable through the immunization billing. So, and then conducted Tdap vaccination clinics in Carson City and Douglas County. And Tdap is the pertussis, tetanus, diphtheria, and pertussis vaccination. So.
Is that required by statute?
Yes,
it is.
for
It's
kids
required
in school.
when you're teeny, and then the booster before at age 11 or before 7th grade, and then you need a TD booster every 7 to 10 years. All of you in the audience, every 7 to 10 years.
Can you age out of that?
No, you may not.
Good try.
Dr. Pintar, TD is tetanus.
T is tetanus, D is diphtheria, P is pertussis,
Yeah.
and the A is acellular pertussis.
And then we're in full swing for the school-located flu vaccination clinics. Those have been scheduled in Carson City, Douglas County, and Story County. So they've
With
got
virtually 100% school participation this year, I believe, which is quite an accomplishment.
Yeah, we're pretty excited about this, and we'll be very busy out there giving flu shots to the kids.
I'd like to acknowledge the back rows here. Those young ladies back there are the gals who go out to the clinics, put up with those little screaming mimes. I mean, well-behaved children. But even more, these are the ones you have to butter up because they will also be giving your vaccines at the drive-by flu clinic. So be very sweet to those ladies.
Hey, come on. Okay, and now our chronic disease prevention health promotion program. This is a little old news, but we didn't have a Board of Health in June, so I wanted to report on it. May was the National Public Health Week, and we partnered with Parks and Rec and did a Trail to Good Health on the linear trail. So we had little signs that people could read along the way. Our Safe Routes to School program, the Bike to School Day was May 7th. In May, there was the Ride for Reading events, which a number of us participated in and took books in with our bikes to schools, and the kids were pretty excited about that. And Courtney Bloomer went out and taught bike safety at the elementary schools.
On the Safe Route to School, the RTC started this week, the Hells Bells Path, after some starts and stops, but they're out there doing construction right now, so.
Yay, good. And then also within the Chronic Disease Prevention Health Promotion Division, there's the abstinence program. And through that program, the Policies and Procedure Manual has been drafted. The PrEP program, which is the Personal Responsibility Education Program, marketing materials have been developed. We've developed that partnership with ROP and are getting out there and holding sessions. So far, 20 participants have completed the program. And also within abstinence, we've got what we call FAT, which is promoting health among teens. And 5 sessions have been completed with 21 teens participating. And we continue to work with an existing partner organizations to reintroduce the program to the administrators. And
Nikki, correct me if I'm wrong, with the chronic disease division is entirely grant funded, is that correct?
Correct.
So all the programs within there are grant funded?
And this, the PrEP program is one of the ones just recently that I have brought to you to ask for acceptance of that grant. And then we're still continuing with our accreditation activities. So recently we had the NACHO grant, and there we submitted our grant deliverables, which included the materials from our public health development conference that we held here in Carson City. And we also had our some documentation reviewed from an outside reviewer and received that summary report. We have fine-tuned our descriptions of the documentation teams and the processes and submitted that final report to NACHO. Other activities, we're continuing to strengthen our performance management system within the health department. Our workforce development plan is near completion, and that's been worked hard on and spearheaded by Sandy Workrow.
That's an internal workforce program.
Yeah. And then we had 2 staff members, Valerie Coppe and Taylor Radke, attend our EFAB training. And the EFAB is that's a system that the documentation is submitted into for accreditation. So that's our process to get all that documentation submitted. And that concludes my report, if there's any additional questions.
Other questions or comments? If not, I will entertain a motion for acceptance
I move to accept the director's report and give direction to staff on CCHHS activities.
Second, excuse me.
Motion and second. All in favor, say aye. Aye. Those opposed? Motion is carried. Thank you. Nikki, I would like to go on to item 10C, which is the report on animal service donations.
Okay, before you is our report on the donations that are year-to-date. So fiscal year 14, you can see that the $21,347.10 in gifts donations fund, and the New Hope Fund is $465.96, New Shelter Fund $200, and for a total of $22,013.06. For fiscal year 15, I would like to publicly thank the estate of George Texeria for the generous donation that we received, and through that donation specified that it needed to be divided into our gifts and donation fund and our New Hope Fund. So some of those funds are restricted and can be used only for medical expenses of animals. And that total amount was $195,197.47.
I will entertain a motion for acceptance of this report.
I move we accept the report and extend our gratitude to the estate.
Second.
Motion and second have been made. Those in favor, aye.
Aye.
Those opposed? Motion carries. Thank you. I would like to go on, well, I'll remind everybody that we do have a community health improvement plan in place for our community. Before Kathy came in, I was thanking her for lighting a fire under certain state agencies, getting us, where'd she go? Oh, there you are. Oh, I'm looking on the wrong side of the road here. Getting funding for the flu pod, and Kathy has also been very busy, along with Valerie Coipe, working on two of the community issues that have been combined into one that really affect our health overall. So if those ladies would come forward and give us a little report on how they've been doing with community issues A and B, I'd appreciate it.
Good morning. Okay, the community issue A is designate and maintain a website to improve access to health information and health resources. And then community issue B is health data. Not one of my favorite things. But anyway, in order to improve upon health information being disseminated throughout the community and allowing people to see just where services are, we, of course, went to the website. And we've hired a young woman who works 30 hours a week, and essentially her task, in addition to keeping all the information around health issues, specifically in our case, substance abuse issues, updated on that website. But she's also developed a link in response to this community issue A called Local Services. And every single service that we can garner up that's related to health is on, or even supporting people in terms of needing food, needing shelter, is now loaded down into that Local Services tab on our website. Right now, we've subsetted it by about into 25. That, of course, needs to be consolidated. Right now, we're just trying to gather the services and get them all in one location and then start to sort them out, which we've begun to do, and now we just need to refine it down more. The idea is that if you're a school counselor, for example, and you've got a child in crisis there next to you, you're able to go in, click on the Local Services, and it pulls it up. You say this child needs domestic violence assistance, you click on it, and the services in our community will pop up. So you're not sitting there with a directory and trying to sort through it. The other problem with a handwritten directory is, as Susan has tried, I think, to make very clear to people, we have a lot of services, critical services in this community that are grant-driven. And they can be here today and they can be gone tomorrow. So that's the problem with having something like here. You get it all updated, it goes to print, and then half of it is then outdated. So by keeping people engaged on the website, we're able to keep the service information updated. What's the problem with that? The problem is getting people to keep giving us that updated data. So if they change a director, lose a service, gain a service, they need to be reminded to tell us that. Let's see, the website can be translated into 30 languages with a click of a button, which you might want to try this. Actually kind of hilarious how some of those languages get interpreted. But anyway, so Spanish is on there, so that's one of the things that we do.
Kathy, would you write out the website? I thought there might be a slide for it, but there's not.
Okay, Partnership Carson City, it's just the name of our organization, so www.partnershipcarsоncity.org. And while you're on there, you can peruse all the update information on drugs and all sorts of other stuff. The gaps,
Kathy,
yes.
excuse me. One, the listing of community health services or service providers, I think, is extremely important. I think it's very beneficial to be able to click on it and go to who it is. And I think you and I have discussed in the past, and I think you just talked about it, and that is keeping this thing up to date, because I think while I've been involved somewhere along the lines, we've seen 2 or 3 of these studies come through, and they're all either, put on a disc or they're hard copies, and then they just kind of go away, as people come in and out. So I think that we need to, the young lady standing next to you, I think we need to find a way to make sure that we're actively keeping that list up to date, because that's going to make it work really well. So.
Absolutely, and that's why we have committed the services of a millennium person who understands computers. We love her. Yeah. Tana is committing 30 hours a week to us, and that's what she does. She sits in front of that computer, she multitasks, and she keeps that thing as updated as we can. But keeping the agencies and the providers of services reminded to do that's the most complicated part. But we're working on a system where we will automatically send it out to everybody, review this is what we have on the website, have there been any changes, and get it back to us. So it's a large task. We have a lot of it, as you can see, just through Carson City Health and Human Services. And by the way, these people are absolutely amazing. This is the most amazing staff. I love working with them. Every single one of them is an Energizer bunny, and gives me an excuse to go home and rest after just being in the same room with them. So they're really awesome.
May I ask a question?
Sure.
I think that website's great. Is that linked to the city website as well?
We can link it in. We can link it in to theirs, and we can link it in actually to anybody's. And anybody who wants to link into ours, we do the same. Every single agency, we have their website on there, so they can link back in. So where Carson City Health and Human Services are listed, that link should be there, and it goes in there.
Thank you.
Mm-hmm. And believe me, I don't understand how any of that works, mind you, but as long as Tana does, we're good. Are there any other questions on just the website? Did you have anything you want to add on issue A?
I think you covered.
Okay. So the next one is the data piece. And this, of course, is, we get data sources all the time. I get sent in PDF files tons and tons of data books and data sources. Right now, we're putting them all onto a data resource link, again, on our website. So again, when people are writing grants, that seems to be the biggest need. They can click in there, go to the data portal, and find whatever data has been made available to us. We have it Rural Nevada Health, Nevada Health Indicators, this CHIPS report. It's all on there. The problem with data is that by the time it gets vetted and by the time it gets printed, it's usually a year and a half old. And as the sheriff can tell you, that gives us the opportunity to see 3 new drugs in our community, so that we've never heard of before. So we have to take that data with a grain of salt. We're going to work with Dustin Booth, who is your epidemiologist. Is that what you are? That's pretty impressive.
An environmental health.
That's even a long name and everything. Anyway, work with him because he has what they call the Nevada Core Health Indicators, which is taking, there's a million of them, the health indicators that we want everyone to sort of standardize. And on this sheet, it also lists out the data source that's the most reliable for identifying those health indicators. So we're beginning to fill that chart out and click through it. And when we get done, we should have something that should be allowed to compare us to other communities and statewide data. We're also encouraging our local agencies when they write their grants to use that data so we're all saying the same numbers. Because right now, you can ask somebody, for example, what's the population ethnic breakout in Carson City of 5 people, and you'll get 5 different answers. Or how many youth are drinking, more than 5 drinks at a time in our community. Again, you'll see quite a variety of answers there. So we need to be standardized, and so that's our goal. Right now, the data is available to people. Now it's a matter of refining it and getting it standardized for consistency. It's a big job. And you want to?
For the record, Valerie Quape, Carson City Health and Human Services. Just a little historical background on Community Issue B. One of the reasons why this was put into our Community Health Improvement Plan was when we started our community health assessment process, I believe in 2010, 2011, we discovered that it was really difficult to find consistent, reliable data for Carson City. And that's not unique to Carson City. You find that around the state as a whole. So one of the things that we're doing as a part of our accreditation initiative is we're also trying to streamline our health data processes and collection and reporting so that we also have internal data that is consistent and reliable, so that as we move forward with our next community health assessment that will probably need to be starting in 2015, we do have better data to really move forward and make sure that we're targeting the right areas in our next community health improvement plan. Thank you.
Jeff?
That process that you're going through and creating for Carson City, can it be exported to other counties, other jurisdictions? Can we make money off it?
That's not going to get you off the grant funding hook here.
I don't know that we could make money off of it. I think the purpose of this is just to make sure that across the board and even at the state level that everybody's collecting the same data. I know that the state is considering public health accreditation as well as our other two local level health departments in the state, Washoe County and also Southern Nevada Health District. And so having these processes in place will help all health departments in the state achieve accreditation, which means that we're all running at the same national level of high achievement.
And what I'm hearing from you is that we're kind of the leaders in this thing, and I would like to see that leadership noticed and expanded to the state.
Thank you.
Thank you. Are there other questions or comments? Thank you, ladies, very much. Another one of the issues in our community health improvement, our CHIP plan, has been pedestrian and bicycle safety and access. Courtney, I believe, is here today to tell us what progress she and her group of fine wheeled friends are able to make.
For the record, Courtney Bloomer, Carson City Health and Human Services. I have a presentation, it's coming. Boy, it is a special day for technology, isn't it?
Courtney, while you're waiting, bicycle-friendly community, RTC's put in the application. Have you heard anything?
The application for bicycle-friendly community was submitted just last week, I believe. The results we should have back on whether Carson City is a bicycle-friendly community mid to late November. So probably by Thanksgiving, we'll know if we earned a designation. Dan Dunges over at Public Works, and myself and a number of other community members and muscle-powered volunteers work together to put together that application. So we're very hopeful that the city will be able to join Carson City Health and Human Services as a bicycle-friendly entity.
You know, that's a big deal. I mean, if we could get that. And I think, you know, we've tried. I think the last time we did it, we got close. Got kind of honorable mention. But I think, you know, that's one, you know, it's like Runner's World and things like that where, you know, got a runner-friendly community, but bicycle-friendly community is a good marketing tool for Carson City. And it's one where, you know, it cuts across all strata of society. So, you know, let's hope that we get it. And if we do get it, let's have some thought into how we're going to push that up and let people know that, you know, we are indeed a bicycle-friendly community
We certainly want to definitely make sure that we use that as a marketing tool. It could be a really great driver for development in Carson City moving forward, so.
It's a big deal.
Fingers crossed.
Yeah.
All right, presentation is ready.
Before we go off the subject, the other thing, Mr. Mayor, is we need to recognize that when we get the designation, we need to recognize the people that did it, because it is things like the improvements that you saw on 5th Street from Solomon towards the freeway, widening the road and building sidewalks with grant money. It's not I don't know, clean up the streets, you know, clean the dirt off the streets. It has taken, it's a major project to get this designation.
And I just want to add to Supervisor McKenna's comments that not only has it been a large infrastructure project, but it has been a collaboration between a number of different city departments to even be able to approach this. The Health Department, Parks and Recreation, Public Works, and the Sheriff's Office all play really big roles in our application and in our bicycle friendliness outside of the application itself. Okay, moving on. Get moving, Carson City, biking and walking. The Community Health Improvement Plan, of course, has issue K as bicycle and pedestrian safety and access. The first thing that I want to take an opportunity to remind all of you here today, and Dr. Pentar alluded to this earlier, is that we are all part of the public health system. Everyone who's here today, whether or not you work at the health department, you play a vital role as leaders of our community in determining how healthy and how safe this community is. And so really, as we're going through this presentation, really think of yourselves as members of the public health team, because that's what you are. The decisions that you make here as the board and the things that are coming in our community moving forward are really all public health initiatives in some way. So we appreciate your involvement in that. So, why is Bike Ped important to Carson City? A number of reasons. I'm just going to highlight a couple here. First of all, this is a health initiative, so the first bullet up there, promoting health and preventing disease. Bicycling and walking are great cardiovascular exercise. They also are great stress relievers. The other thing I would like to bring up is the equity piece. Carson City is a diverse community. We have people who bicycle and walk for a number of different reasons. One of those is our strong recreational background, and we are a destination for biking especially. But also, there are people who bike and walk in our community because that's the option that they have. So when we're looking at bike and pedestrian safety and access, we're not talking about tourism or the spandex warriors that are out on the weekends riding their bikes. Of course, those people are important parts of the bike and pedestrian infrastructure. Hey, I'm guilty too. I'm guilty too. But we're also talking about those people who rely on their bicycles and on their feet as the way that they get to their job, the way that they access healthcare in our community, the way that they get to the grocery store. So we want to be sure that we're accommodating all of those people. Okay, so from the CHIP perspective, a little bit of background on how this got included in the first place. Between 2005 and 2010, the Sheriff's Office recorded 50 ped accidents and 49 bicycle accidents. Since 2011, and this was as of April, I'm sure you all are aware we've had a number of pedestrian accidents since April, and the Sheriff's Office is now working on addressing that. They've done some really great work here the last couple of weeks with some ped enforcement on Carson Street, so thank you. Another one tomorrow, right. So we appreciate their involvement. Another enforcement effort. I hope there's not another accident tomorrow. So we have seen recently a spike in those accidents, so we want to continue our progress on this issue. Urban streets and rural roads with high speed limits, discontinuous bicycle and pedestrian transportation systems, and careless drivers and car-oriented culture make for dangerous conditions. I didn't write that sentence. That's talking about the state of Nevada and applies to Carson City, and it was in Transportation for America's Dangerous by Design report. We kind of got called out as being not very good at this. And that was way back in 2009. We've made incredible strides since then, but we're not done, which is why we're still having this included in the CHIP. The legislature in the state of Nevada has made a number of advances with some laws that they've passed there to make it safer for bikes and peds in the state of Nevada. And there are some additional legislative things that are happening moving forward. The laws that we enact, of course, are only useful if they're enforced, and the Sheriff's Department has done a great job of that. I know that over the summer, the volunteers were out for bike enforcement a few different times, and so we're really stepping up in all areas, infrastructure, enforcement. The other 3 E's also happen to be encouragement, education, and evaluation, and we're doing all 5 of those things, rather. Next. Objectives and action steps for the CHIP are to promote activities that encourage increased walking and biking. We're doing a good job of that, and some of those activities have already been highlighted here today. The Safe Routes to School program, of course, that I oversee at the Health Department, has been doing a lot of work with the youth in our community, teaching them bike and pedestrian safety and encouraging them not only to take part in biking and walking, but to do so safely and responsibly. We've also been out at a number of activities. Unfortunately, National Night Out this year got canceled, but we've been at a number of different community activities, giving out helmets, promoting safety, trying to get the community aware of some of the bike laws and pedestrian laws that they should be following so that they're being as safe as they can, and educating not only the pedestrians and the bicyclists, but also the drivers, because that is an important piece of it as well. Bikes and pedestrians can be doing whatever they want, but if you've got drivers still out there on their cell phones and not paying attention, it's still not a safe environment. So those are some of the activities that we've been doing to make Carson City more biking and walking friendly. So there's the 5 E's right up there at the top. I just kind of mentioned those. As part of the CHIP, we got together a committee of people who are concerned citizens, a number of people who work in transportation from the state level, from the city level, and just some people from around the community who have a strong interest in biking and walking safety. And that there at the bottom is kind of the wish list that committee came up with of things that they'd really like to see in Carson City that would make this community as bike and ped friendly as possible. And there are a few things there you can see that we've already kind of started working on. More trails and activities. I just want to really highlight the work that's being done on the west side of town by Muscle Powered with our recreational trails, and also some of the work that Public Works is doing with securing grants to do additional work in town. Supervisor McKenna earlier mentioned the Safe Routes to School project that's happening over by Eagle Valley Middle School. Additionally, a Transportation Alternatives grant has been secured to connect the freeway bike path, so that's also coming. So we are addressing some of these things. There are always more things that can be done, and there's just a little list for you guys to ponder as you're moving forward and considering things that we can do in the future to make our community more desirable and livable, and of course bikeable and walkable.
On that TAP grant for the freeway trail, you also have to thank Open Space. They kicked in some more money.
Yes, also Open Space. Parks and Rec has also been a great partner in many of the things that we're trying to move forward in this arena. I especially want to thank Juan, and I'm quite sad that he's departing. So community health isn't about what the health department does, it's about what the community does. I can stand up here all day and say biking and walking are great and we should do all these things, but really it's up to the citizens of Carson City, up to the leaders of Carson City to move this initiative forward. And it's the decisions you guys make, right up to the decisions that people make on a daily basis of whether they're going to ride the wrong way in the bike lane, whether they're going to put their helmet on, whether they're going to cross their street at the crosswalk or dart out at a mid-block crossing. Our efforts are only as good as what the community is doing, and so we really want to thank you guys for your support of this particular initiative, and we hope to do even more going forward. Thanking a few of our partners. There it is.
I'd like to make one more comment. I think, the last time I looked, having a pedestrian-friendly and bicycle-friendly community is one of the top 10 reasons why that people look for when they're now moving, thinking about coming to an area or looking at to raise a family here. And it may even be up in the top 5 and even closer than that. So when I say it's a big deal not just for our health, it's a big deal for the economics of our community here. And it's something I personally think that we need to, you're absolutely right, it's a community effort, and we need to make sure that we keep focused on that type of activity because it'll pay dividends in the long term. Okay. Thanks. Sorry for the...
Absolutely. No, the mayor's absolutely right. Whether it's drawing new businesses and new residents to our community or serving as an economic driver for tourism, biking and walking and the resources that we are naturally blessed with here in Carson City really provide us something that we can capitalize on. So you're absolutely right.
Thank you, Courtney. Other questions or comments? Thank you.
Questions? Thank you.
The Preparedness Division of the Public of Carson City Health and Human Services has been working for a long time on emergency operations plan, and we asked Angela to come today to give us an update of the piece. As she will explain, emergency operations is not just limited to Carson City, but we do play an integral role. So, Angela?
Good morning. Angela Barroso, Public Health Preparedness Manager for Carson City Health. And we wanted to present to you today some plans that we've been working on. And just to give you some background, for any agency that receives federal funds since 2005, you had to be able to function or structure under something called NIMS, the National Incident Management System. And so for those of you who may be familiar with what emergency management and fire does, that is how they structure the incident command system. And we are also required to do the same thing. So it has been helpful for us to develop a Carson City Health and Human Services Emergency Operations Plan. It is a public health plan that would be an appendix to the city's emergency operations plan. So that's what I think you got in your materials. So our basic plan is just basically a structure of how we function should an emergency arise, either that the EOC is stood up or is not, and that we would function internally under the appendix that we sent to you, which is the Department Operations Center plan. So again, we would function under incident command system. We have roles and responsibilities for what we would do within the community and within the department. And I would welcome any questions or comments you would have on that.
I just had one question, and this is on page 16 of the document that we got in our package. Conducts under environmental health and responsibilities, conducts surveillance over zoonotic diseases?
Those are animal-based diseases.
Animal-based diseases. Okay,
right.
Thank you for the clarification.
Sure. And as you see in those roles and responsibilities and in the Department Operations Center, a lot of what we do, or what we would do in emergency, is our day-to-day operations. A lot of the things that you've seen in these plans are things that we do anyway. But this also just gives us a structure on how we may need to stop doing some of the services that we do and focus on what our emergency responses are in those plans. And the other thing that I think happens for us is that not only does this help us in our grant deliverables, because public health preparedness is 100% grant funded, but it also ties into our accreditation responsibilities as well as like our Title X grant planning. When people who actually evaluate how we perform actually look at things like this, is do we actually have an emergency operations plan? Do we know what our roles and responsibilities are in the community and how we would actually function as we deal with a public health incident? And when I say incident or emergency, it isn't always something like fire, flood, or whatever, but we functioned this way under the whole rabies long-term event we had, I think, in February and March, where we actually get together every day. We have a briefing. We talk about what our objectives are in order to deal with this situation. And the same thing happened with H1N1 in 2009, where the city's Emergency Operations Center may not be stood up, but we are functioning under emergency operations at that time. Have a briefing every day. We have a plan and objectives, and then we try to meet those objectives, and then we write an after-action report on how we did. We do a debriefing with all of our partners. And so that's just all part of how we function.
Other questions? Thank you, Angela.
Thank you.
Our final issue today is a presentation about a recent quality improvement project that has been conducted. As I mentioned earlier, under our continuous improvement objective as a Board of Health, the department has the various divisions within the department conduct quality improvement activities, and Ronnie Gallus and staff are here to talk about one of those today, whatever the heck time it is.
Yeah. Good morning. For the record, my name is Ronnie Gallus. I'm the Clinical Services Manager at Carson City Health and Human Services. So today we're going to be presenting a clinical efficiency quality improvement project. This project started because grant requirements and changes brought on by the Affordable Care Act challenge us to use our electronic health record in a more meaningful and more productive way. By ensuring that we're using our electronic health record, we're meeting grant requirements by making sure that we're documenting things that our grantors are expecting to see, and also, which equals funding for us. And then also, with the Affordable Care Act, I have mentioned in the past something called meaningful use. And it's a way of using our medical record in a meaningful way. There are requirements that we need to meet, and those requirements, meeting those requirements, actually equal additional funding for our program. And although funding is important and utilizing our electronic medical record is important, our patients really are the most important. And part of this project is making sure that we're still doing quality care for our patients and not talking to our computers, but actually talking to our patients. As many of you may be experiencing in this healthcare world, a whole different experience with your doctors when you present to them and they're actually using a medical record versus the old-fashioned now paper charting. So today, the presenters will be one of our nurse practitioners who works for Carson City and our Douglas County site, who helped to lead this project, as well as a collaborative agency, Health Insight, who received a grant to help us and other agencies meet meaningful use requirements. So Eileen is going to talk first about meaningful use so that when we keep using this word, you kind of have an idea of what it is. And then Tammy will talk briefly about the quality improvement project.
Ronnie, before you go, just a quick question. Is the initial data entry on medical records done on an electronic device like a tablet, or is that done on a hard copy and then transcribed into a medical record, electronic medical record?
Everything that we're doing is on laptops that we have laptops in every clinical room and then in different clinical areas. So
Okay.
it's being done basically the same day that services are being seen.
Okay, thank you.
Hello. For the record, my name is Eileen Colin, and like Ronnie said, I'm with Health Insight. We are a private, non-for-profit organization, primarily funded, well, actually kind of now it's 50-50% funded by grants and other contracts. We primarily are located in Nevada, New Mexico, and Utah. However, this month we just have expanded into Oregon with a new grant that we've received. In Nevada, and it's an active slide. So Health Insight Nevada specifically, we're involved in many different options or activities, grants, contracts. Some of the things I think you'll be most interested in, and I'll point out, are we are the CMS, Center for Medicaid and Medicare Services, designated quality improvement organization, which has now become the Quality Innovation Network. We just received the new grant for that, or an extension of the grant this month. We also operate a health information exchange, a clinical exchange of information to provide access to patient information and patient data at the point of care from any participating healthcare organization in the state. And then there's a couple of other things that we do. We kind of say we work from beginning of life to end of life. We have some programs called Strong Start, trying to reduce the preterm births, and then also in the long-term care facilities, reducing the readmission back into hospitals. Why I'm here specifically is we've received a grant called the Regional Extension Center Grant. That enables us to work with primary care physicians at no cost to the physician to adopt their electronic health record and use it in the meaningful manner. The meaningful manner is what has been designated as part of the American Reinvestment and Recovery Act, which gives an incentive to providers to actually utilize their electronic health record, meeting these requirements that I'll discuss. So meaningful use. This is the technical term as designated by the Office of the National Coordinator, a federal agency. So it is using the certified electronic health record 2, improve quality, safety, efficiency, and reduce disparities. Engage patients and their families, which is part of why you're hearing about the patient portal. Go and log yourself. Improve care coordination, population and public health, which I know is very important to this group. And maintain privacy and security. So meaningful use is a 3-stage process with increasing complexity. Stage 1, which is where your organization or the department clinics are at right now, is capturing data in a structured format so that it's queryable and can be used for improving quality. Stage 2 is just launching. That's going to go into advanced clinical processes, improving the overall use of the system and data, which ultimately in stage 3, yet to be defined, in the hopes of improving outcomes, improving clinical outcomes, and reducing the bad outcomes that we keep hearing about in the news. Thank you. So, as I mentioned, there is an incentive. There is an incentive for all 3 providers within the clinics to meet this meaningful use measure. The total incentive that can be obtained is $63,750 over a 6-year time frame. So what we're looking at right now for year 1, and just so you know, it's really exciting. It requires the providers to have at least a 30% Medicaid patient volume. We are almost there, and we are actually looking at potentially being able to attest in the very near future, I'm thinking a month or 2, out to attest and actually receive the first year incentive payment, which is $21,250. So that's really exciting in the efforts that everybody's been going through, and all of the staff and the providers in making sure that they're capturing the data correctly.
Where does that money go to? I mean, who gets that money?
So the federal the federal incentive
that's
program.
Good to me. Okay.
The federal incentive program is actually designating the incentives to the providers with the ability to reassign it to their organization. And so what we're seeing, our organization, we're working with over 1,400 providers to do this. We're seeing that most of the providers that are in organizations are reassigning it to the organization that's funding the electronic health record. Thank you. So stage 1, this is what we've been working on. I actually started working with the clinics about a year ago. There are 15 core measures that must be met. All of them must be met in order to meet meaningful use. And then you'll have another section of menu measures, which is a menu list where you have to select 5 of. So what I'm showing here is the list of measures, and we've highlighted ones that were specifically focused on by the Carson City and Douglas County clinics. So providers had to meet and actually do these activities within their system for 30%. Well, the first one's 30%. But the ones I really want to focus on are maintaining an up-to-date problem list for all patients. We had to have at least one problem listed in their problem list for 80% or more of the unique patients, or a designation of no problems. And then electronic prescribing. That has been something that, because the clinics had handed out or did a lot of the dispensing internally, there was a challenge in meeting that. So there's been some activity and movement in moving those forward. Smoking status, recording smoking status for more than 50% of the patients over the age of 13. So that's been another one that we've been able to increase. What you'll notice is a lot of these measures are part of normal clinical processes, and so it is typically captured, but maybe not in the right spot in order to be structured or considered structured and queryable. Thank you. The last 2 core objectives I want to talk about is providing patients with a copy of their health record within 3 business days. So they must receive, 1, a clinical summary of their visit. So I'm sure you have all been to the doctor recently, and they give you a piece of paper at the end of your visit. This is where it's driven from. In addition, electronic health protection. So you probably have recently heard about a security risk analysis that had to be conducted. Well, we actually provided a template that was developed by national efforts, the Office of the National Coordinator, as well as organizations similar to mine throughout the country, to evaluate the risk. This is actually a twofold thing. One, meaningful use wanted to ensure you're actually doing it. And two, doing it correctly and setting it up appropriately is going to set you up for compliance with HIPAA. Everybody's familiar with HIPAA, and then high-tech, the additional requirements. So protection from multitude of audits. Thank you. Here's your menu set. We only had to select 5 of these. One that I want to point out here, when I started working with you guys, you didn't have a patient portal. That has been launched, and we're seeing an increase in activity and an increase in patients actually signing up and actively engaging with their own health. Okay? Another thing to note here is public health. Public health is a component of this. The agency must work with either the immunization registry, which I've heard earlier today that immunization is really big, to submit data to the registry, WebIZ, Nevada WebIZ, and syndromic surveillance, if appropriate. So, go ahead.
What's syndromic surveillance?
No, that's okay. I think it's a great question because it is one I get from everyone. Syndromic surveillance is actually just having certain indicators, high fevers, certain coughs. If they're presented in a hospital, it must be presented, or it must be submitted to a registry so that they can recognize, hey, all of a sudden we have 50 cases within the 3 hospitals in Reno of certain syndromes, and then it can be recognized and treated, announced, trying to actually work as a public health group to make sure that we ensure it doesn't expand. So, okay, we'll go ahead and hand it over to Tammy. Thank you.
Tamara Bowman, nurse practitioner, Carson City Health and Human Services in Douglas County, and I'm going to talk to you about our quality improvement project. We developed a team of 3 of us nurses in the clinics to try to help clinic efficiency in a way of using our electronic medical record. And we have a lot of things that we can derive from all the data, so we set up a little program to see how we could do that, and I'll present that right now. My team was Rachel Rasner, she's sitting in the back, and Judy Barlow, who's sitting right next to her. We are using the FAB infrastructure for the project, and so our first thing was to try to develop an aim statement, and that was basically to improve the efficiency and accuracy in clinical documentation to reflect the meaningful use projects that we need to be aware of now. So the problem, clinical documentation deficiencies and inefficient time management and charting. Issue determination was how we determined we needed to increase efficiency was through chart audits and through time that patients were spending in the clinics, either with the provider or in the waiting room while providers were spending time with other clients. So chart audits reflect the inconsistencies of charting and the deficit areas of the structural data that we need for Title X grant requirements and for meaningful use. And she went through the structured data components in her slide, but we'll talk a little bit more about them as time goes on. The things that Title X, who is our major grantor for family planning STD clients in our clinics, are focused on the following: preconception care and interconception care, meaning are we talking to every single patient, male or female, about their health status in between pregnancies and before pregnancies occur. So we have put this into structured data so that we can collect the data on who's talking to these clients, or if they're not being talked to, that we can go back and say, why was the visit not about that, or did we just simply miss it? So immunization screening, sorry, I have a dry throat. We are trying to ask all our clients at least yearly, or sometimes even more often if needed, about their immunization status. We are directly linked in our clinics to WebIZ, so if they have been in Nevada for long periods of time, even if they were with different providers, we can look up their immunization status and report it in our eClinicalWorks program. Specifically, we're worried about measles, mumps, rubella, the Tdap that we discussed earlier, and HPV vaccination for young adults. STI screening for sexually transmitted diseases, especially chlamydia, gonorrhea, in men and women under the age of 25, which is a national and CDC standard. And of course, meaningful use objectives and measures include smoking, determining the smoking status of all the clinic clients. Go ahead. Resources and support come into the plan. We needed to kind of adjust schedules for the nursing staff to be able to spend time on this project. Of course, we needed computers and our eClinicalWorks software, which is our electronic health record. Hypothesis of change was to become more efficient and proficient in our professional documentation in the electronic medical record, to increase meaningful use, and so that we can soon attest to our Medicaid status with the federal government. Go ahead. So this is some of the, a bar graph to show some of the things that we've been looking at in our goals. And how the percentage of what we've accomplished so far. So up to date, problem list, which is meaningful use data, meaning we would document any problems that the client came in with, whether they were family planning related or not. We want to make sure that we have those listed so that we can appropriately refer these clients or take care of them in the clinic if it's within our realm. So we needed to be the goal is 80% by December 2014. Recording smoking status is supposed to be over 50%. Electronic copy of the health record is supposed to be 50%. That was something that we were lagging on in the beginning, but we have substantially, and you'll see in one of the next slides coming up, that we've increased that a lot. Visit summaries, same type of thing. It's just a quick summary, doesn't have everything on there, but something that the patient can take home and keep with them if they have other health visits, so that maybe the other providers, if they didn't have a chance to get records to them or signed out to the next provider, they can take the copy of that summary and the next provider would know what the patient needed. E-prescribing, which means we prescribe straight to the pharmacies from our electronic medical record in the office. Being a Title X funded clinic, we do have non-insured patients as well. Those non-insured patients or clients usually receive medications from our clinic. But now that we're getting a lot more Medicaid clients and a lot more insured clients, we have to send those clients to the pharmacy just because of the way everything and the laws divvy out. We have to send insured clients to pharmacies. So our numbers were initially quite low with e-prescribing, but they are growing as well now that the ACA is intact and we are seeing a lot more insured clients. So it's actually a very nice feature, very time saving. And then testing for women under the age of 26 for chlamydia, we need to be at 90%, and I believe we are at that mark. Next slide. So we enlisted with Health Insight to get the help of an expert in the area of meaningful use to ensure that we were collecting all the right data in the structured fields, because it could be in the medical record that we did talk to these patients about something, but if it's not in a correct area in the electronic medical record, it's not usable data. So it's not going to just look through all the data, whether it's in a progress note, to put it into the meaningful use structured data. So we had to create structured data areas within our electronic medical record to support this and have it in the right areas to be captured for reports. So that was part of the project as well. Enlist the help of our eClinicalWorks, is who our record is, but Physicians Management Select is the people who help us maintain that record and are a huge asset in the IT portion of that. And then to form our group of nursing staff to ensure that we're using the electronic medical record to enhance the patient appointment or client appointment to its full benefit and to get the full amount of data that we needed to collect for our grantors. Okay. So the implementation of templates to ensure adequate and efficient documentation. Templates are used as a client-type visit. So we've made tons of templates for the types of visits that we do that have a lot of data already input into the computer system, so we can just click a quick box to say what the experience was like, and then of course there's always notes at the end to be able to customize that to that particular client. But this is a really time-efficient way to have an annual well woman exam, and if everything is normal, you just click the button and everything populates as normal. And then you just have to add her medications and what type of preventative medicine counseling we have done with her. And instead of hand typing in everything on every part of the document, templates are set up so that there's data put in all these areas, and we just have to make a quick checkbox so that it's more efficient and time-saving for clinicians and the patient. So that's what templates are. So we have developed probably over, I'd say probably 25 to 30 different templates for our patient visit types to enhance the time-saving aspect of that. Consistent documentation of laboratory work. This also helps us maintain HIV counseling, and asking if they want testing is part of a structured data that we need to report to Title X agency. So we have put that in, and so that's a documentation that we have asked, and they've either accepted or declined. It also goes true with the STI testing for chlamydia. And that way we can capture that data in the structured census for meaningful use. And if the testing is done, it goes into the appropriate place in the electronic medical record right from the lab that we use. So we have interfacing with LabCorp here in Carson City. And creation of consistent documentation of the structured data. I've talked about that. And the QI team that have been that I've introduced to educate the remaining staff on the templates and the use of the structured data and where to put this important information so that we can make sure that we are getting better chart audits and that we are going to be able to get the funding that we deserve through these templates and the changes that we've made. Our short-term goals were to meet 25% of the meaningful use criteria within the first quarter of 2014, to decrease the chart audit deficiencies by 25% by May 2014, and after the templates had, now that they have been created and approved, that our staff would be trained within 2 weeks of that time period, and we've accomplished all those goals. We have decreased our chart audit deficiencies by over 50% by the July timeframe.
Which makes me happy, Tammy, because I have to do those chart audits, or I'm the third run in line, so less for me is okay.
Good deal. Okay. Our long-term goals were to, by creating the templates for the different patient visit types, to be more efficient and accurate, and to decrease patient time with us, because their time is important as well, by 10 minutes. This will be something that we're going to have to work on still over time, but we'll capture that data. There's places in eClinical that we can put the time in when they arrive, when they go to the back office, and when the visit is complete and they're checked out. So we'll be able to correlate the time of how long the patient was actually with each person and in the clinic total. So we can look at that data by the end of the year, and also we'll probably use patient satisfaction surveys because sometimes the time that patients perceive they're in the office may not be the actual time that they're really there. And that could go either way. And of course, meeting 50% of the meaningful use criteria by 2014 December, and decrease chart audit deficiencies by 50% by 2014, but maybe we'll be 100% by then since we're already halfway there. And then to attest with Medicaid for meaningful use by December 2014, but that is also going to happen much earlier. Okay. So we're using eClinicalWorks, which is our electronic medical or health record, however you want to look at that, to collect data needed to track our progress by utilizing the reports that we can generate, which are vast. We have a chart audit tool as well. We have meaningful use charts that are located right within eClinicalWorks. And, of course, the patient time that's measured within the office. So this is what we have right now. So August through October of 13 is the dark bar, and May through July of 2014 is the light bar. So our up-to-date problem list, as you can see, has dramatically increased, and then recording our smoking status also, we're at 90%. We're giving out many more copies of the electronic medical record. Our visit summaries are also over 50%. Our e-prescribe is up to, I think it's 80% on the clients, and that will just track the clients that are eligible for that. And then the testing, I believe, like I said, is at 90% for the chlamydia. Questions?
I think this has been a really nice example of how using standard medical input, I guess is the best way to say it, but putting it into a structure has really improved clinical services for the patients, but I think also importantly for the staff, that everybody is on the same page and working together, and I'm very proud of you, ladies, for doing that. Thank you.
Thank you. Share one more thing.
Yeah.
Jen?
This is Ronnie Gallis again, and I just wanted to, we'll field questions, but I just wanted to let you know that as of a report that we ran yesterday, we have now met the 30% threshold for Medicaid in order to, so we had to meet two different sets of criteria, the 30% Medicaid clients, as well as all of the different criteria that Tammy and Eileen mentioned. And as of yesterday, we just met the 30% threshold. So Eileen and I actually have a meeting in a couple of weeks, and we will be doing...
Comes and goes, or
so we will be doing the all of the paperwork that is necessary to actually attest with Medicaid, and then Medicaid will audit us for what we are attesting to, and then after that all goes really well, it is the $21,000 per provider. So, and we have 3 providers. So we anticipate that, like I said, prior to December 2014, that money will be coming in.
John?
First off, I wanted to compliment the group on this report. It was intriguing. I bet you didn't think that you were going to be doing computer work when you were in school, nursing, etc. But it's where we're going. And this is kind of for the city manager more than your group. This is multi-county. It's patient records. I think we need to be aware of and monitor the security of this information. It scares me to have this out there, given it on our systems, and I assume it's on the Carson City system. Mm-hmm. So we got security from, not just security for patient records, we've got security going multi-county. I don't think this is air-gapped from any other system, so it's probably worldwide. I'd like to know what our liability is if this information got out. Some country hacked this, or some group hacked this. It just, I think we need to look at the city's aspect of security and IT providing proper services. I'd hate to have the feds come in.
Okay, understood completely, and we'll take a detailed look at it, and I think we could probably, before the next Board of Health meeting, we could provide a report on that.
I will say that IT works very closely with the vendor in this case, which is Physician Select Management, that the electronic medical record itself has a number of access points that are firewalls, for lack of a better term. And the city IT does supervise the installation. So there, it's certainly an issue that has not been ignored, but it can always be improved.
I was talking to a client the other day, and they said when they started out 10 years ago, they had 4 people in their IT department. They have 30 now. I don't think ours has grown that much, but I don't want to be the first one that these type of records are invaded.
And I just want to report on, we take HIPAA very seriously. We've done a very detailed risk analysis, and we've got a committee that does include IT that is working on different risks that we've identified. And so it is something that we are looking at and continue to work at. And as far as HIPAA, for employees that come across our data within the health department or the IT aspect of it, we do it now a yearly training for it, so to keep everybody abreast of what's going on. So we are looking at this very seriously.
The other thing that sets off bells and whistles that you jogged there is it's multi-county. We have employees in many counties, and probably using the Douglas County systems also.
Well, our electronic medical record it's through eClinicals, and that's the one that we use down in Douglas County also, which is through eClinicalWorks.
It's not integrated with Douglas County.
No, it's not within their system.
I will say, though, that one good thing, having been old-fashioned enough to have a paper record, is that the electronic medical record, anytime that is accessed, there's a fingerprint or a footprint or whatever kind of print you want to call it. So there is some record that somebody has opened and accessed the chart. And that's, right there, a big improvement.
This may come off as flip, but I will tell you that's what Target thought. So it's...
Yeah. So, Mr. Kenna, I mean, the point you bring up is very serious, very important, and as part of our training, we actually, if you come to the health department, we have little sheets of paper that are true stories of fines that have been levied based on different HIPAA privacy violations, from copy machines that have copied electronic records to staff having conversations about health information to electronic medical records. So the importance of this is extremely high, because protecting it could result in financial fines if the information gets breached and that gets reported.
Well, I think the city manager is aware of this and will do what he needs to do to satisfy our worries. But when this started, somebody mentioned that they had laptops that they do in the rooms that they input information. And that scares me, because that's the patient's in there by themselves with the computer. You've had instances where very secret documents are on computers back in Washington, D.C., and the guy leaves it on the park bench and the laptop, and, security is something we need to take seriously.
Right. So I do think it is important enough to bring back at another meeting and talk about in more detail. So I'd love to take just a real quick liberty to actually have the folks, because this is resulting in monetary gain, for the county, for our program. And so there's about 4 people in the back of the room, nurses, the part of the work group, that I'd really like them to just come up and personally introduce themselves. Just take the 2 minutes to do that, if I could.
Again, be good to these ladies, because they will be delivering other services as well.
My name is Maggie Holloway, and I'm the nurse practitioner here at the Carson City Health and Human Services Clinic.
I am Judy Barlow. I am one of the public health nurses here in Carson City. I was on the QI team with Tammy. Oh, I am on the QI team.
My name is Noemi Aschenbach, and I am a public health nurse here at Carson City. My name is Rachel Rasder, and I'm a public health nurse at Douglas Community Health and also for the school-located vaccination program in Carson City Health and Human Services.
Thank you, ladies. We all thank you. All right, I will entertain public comment on any issues that may or may not have been included on this agenda. Hearing none, I will entertain a motion to adjourn. Moved, seconded. All in favor?
Aye.
Thank you, ladies and gentlemen. We'll see you again in, Nick?
2 months.
Thank you. Bang.
We're going to bring the meeting of the Carson City Board of Supervisors back to order from recess. We'll be in recess until about 10:30. Board of Supervisors back to order. We're now going to take up item 14. This is the presentation by the Shade Tree Council, and we have Kyle Horvath here, who's the chair of the Carson City Shade Tree Council. Kyle, come on up. Good morning to you.
Good morning. Cool.
Good.
Thanks for having me, Mr. Mayor, Supervisors. So again, my name is Kyle Horvath. I am the chairman of the Carson City Shade Tree Council. We are the advisory board for all the tree-related issues in regards to our expanding urban forest on public and city property. So what I want to do is just kind of give you an update of where we've been in the last year, where we are in accomplishing our goals that we submitted a year ago. And I'm happy to say I've got the luxury of doing all positive news this morning. So if you have any questions, ask when they come up, or there'll be time at the end. But essentially, one of our goals was to increase the participation of our Arbor Day celebration. This year was our 20th anniversary being recognized as Tree City USA from the Arbor Day Foundation, so we wanted to do something a little bit bigger. So we started our now annual Arbor Day 5K run walk, which added a little bit of value to the ceremony, actually increased participation. It was probably the most well-attended Shade Tree Council event that we've had since being on the board. So I would say probably about 85 participants. We partnered with local businesses for sponsorships and really just had a great event. So in regards to increasing our participation, we nailed that goal right there. So we're looking forward to doing it again, making it a 5K run, but then also moving it to Saturday morning, which seemed to help a lot with the attendance as opposed to Friday night. So this year it was at the Korean War Veterans Park at the end of 5th Street. We planted a Canada Red Choke Cherry, sponsored by Supervisor Shirk. And then we did the 5K run at the adjoining Riverview Park, and that was just a really, really nice setting for that event. So that was number one. Number two, we've been working with the Nevada Division of Forestry on getting a urban and community forest grant to do a tree inventory. And the process was long, and NDF was patient and persistent, and we finally got that application submitted and approved. So I'm happy to say that starting this spring, we will be doing a citywide tree inventory. So what that entails, the details at least, the grant was for $24,000. Oops, sorry. $24,000, and it was to hire a professional to conduct the tree inventory. So what that entails is identifying all of our trees by species, size, condition, and then GPS locate them so it goes onto a digital map. It's going to cover all the public trees in our parks, right-of-ways, and on city property. And essentially what it's going to do is just going to help with the management plan. It's going to create efficiency in the Parks and Rec Department. It's going to create efficiency in the Public Works Department, and just allow for saving time and effort in our tree maintenance in those areas. So it'll be able to be scheduled more efficiently and taken care of more efficiently. Our match to that was 25%, so that was roughly $6,000 that we needed to come up with for that grant, and Public Works Tree Care Fund is offering to cover that, although the Shade Tree Council is going to utilize the sweat equity exchange too, and really show NDF our appreciation for coming through with that grant and working with us. And even though we were the last kids on the block in Nevada to apply for this grant, we're on the books, and it'll go ahead and be completed starting this spring. So that's goal number 2, checked off the list. We wanted to do something for the community to educate about water-wise measures, being more efficient with our water usage. And regardless of whether we're in a drought or not, why not be more efficient with such a precious natural resource? So what I wanted us to do now is take a look at the attachment that I handed out to you all, which is just a listing of what we did. I'll go ahead and read over the tips, but I won't go over the benefits. If anybody wants to see the benefits, they're listed on our Facebook page, Carson City Shade Tree Council, and they've got a nice picture illustrating the idea. So to be water-wise in Carson City, please utilize drip systems at the base of trees and shrubs instead of broadcast sprinklers. Please mulch heavily around the base of trees and shrubs at least 2 to 4 inches deep. Please water less frequently, but water deeper. Water early in the morning, and please do not water between noon and 5 p.m. Water heavier in the spring and summer, and in fall taper off watering to allow trees and shrubs to harden off before winter, and then before the ground freezes, water one more time. This is the one that I've fallen victim to when I first moved down here, is do not overwater. Okay, newly planted trees and shrubs need water every 5 to 7 days, where established planting needs water every 6 to 10 days. Group your new plantings by their watering needs. Please amend soil around trees and shrubs in the fall, and do not over-fertilize the trees and shrubs. And last and most important, given the choice between planting a new tree or a new lawn, plant the tree.
Kyle, the handout that you gave us, did that verbiage replace what was on the Facebook page?
What's that?
The handout that you gave us, did that verbiage replace what was on the Facebook page, which is what we got in our package?
Yes, essentially on the Facebook page, it's the tip, it's the benefit, and then a picture illustrating.
So it corrects all the typos that were on the Facebook page?
Was there typos on the Facebook page?
There's several, yeah.
Okay, I'll go ahead and check that and make those corrections.
Because the handout that you gave us is all correct.
Yeah.
Okay.
And it's the same information. But,
it is, yeah.
Okay.
I wasn't aware of that. I'll go back and check that and make it look much better.
Okay, thank you.
Thanks for letting me know.
It's a great program, thank you.
Cool, and there's actually, we're promoting this not just on the Facebook, on the website, but member Jens Pierman went ahead and designed a nice flyer that we're looking to put in the city buildings, public buildings, and hopefully use to promote other places and stuff like that too, so just to get the word out. And again, this isn't just, timely for this year. This is information that'll be good for years to come. Our next goal was to increase participation at the Fall Tree Care Seminar. Although participation in numbers was about the same as the year before, we actually made a little bit more of a profit, which is a benefit. So the Fall Tree Care Seminar, up until the 5K, was our main fundraising event. This year it's going to be Friday, November 12th here in this room, as well as expanding to different workshops in Mills Park and the Carson High School greenhouse as well. So it's kind of a community-wide thing, but it's open to the public this year, whereas in the past it was all for tree care professionals, but we want to try to get homeowners, students, generally anybody from the public to attend this event. It includes breakfast and lunch, and the cost this year is between $35 and $55, so we've actually decreased the cost as well to try to improve participation. And that depends on if you're getting ISA certified credits. Last year's topic was the elements, so we talked about soils, water practices, fire prevention, care after a fire, and wind damage, and this year's topic is going to be tree care issues unique to the Great Basin. Almost done, guys, thank you. Our budget this year is up, so we have roughly $5,000 in our budget, which has been increasing every year since coming on as chairman, so I'm happy to report that. And it's mainly just because of the 5K, a little bit more of a profit from the Fall Tree Care Seminar, and just flat out not spending as much money as we used to. So that's great, and what we're going to start talking about here to do is use that in supporting possibly some of the redevelopment that's going to be coming down the line in regards to treescaping, and then we also want to use that money to use as match for grants that we've never really ever been able to apply for before, and see what kind of money, how we can make that money work for us, for projects in the future. So we've never really had a budget this big, and we really want to try to make it do something for us. So happy to report we have a budget surplus. We are marketing the Shade Tree Council more, mainly just through Facebook and taking over some more information on the website. And so please follow us, and any suggestions, let us know. We've heard from many citizens, mostly the usual stuff, which would be the dislike of topping practices under the power lines, as well as a couple tree removals that have happened, but they've all been on private property and business property, so we can't really do anything about that except be better at educating the community about proper tree care and everything. Finally, we have one seat still open, so if anybody out there in the audience wants to join the Shade Tree Council, we are accepting all applications. And other than that, that is our year in review. So any questions?
Comments or questions from the board? Anybody? In this survey, it occurs to me when I was listening to you, Kyle, that we have tree branches, particularly at the last fair, you know, on public property where the branch fell off, and I'm wondering, you know, if Shade Tree Council shouldn't devote some time to kind of taking a look at the trees from their health standpoint and from a public safety standpoint of tree limbs falling down, because it seems like, you know, there are some older trees on public right-of-way. It'd be nice to know where those are.
I did hear about that, and that is an unfortunate incident that could have been even worse. I'm hoping that the tree inventory that occurs is going to directly help combating issues like that in the future. You know, all things perfect, we're going to have a much better view of, you know, what we have, how healthy they are, where they're at, and then we'll have benchmarks for years to come to know if our forest is healthy, if it's continuing to grow, if it's shrinking, and then which parts of the city is it growing and shrinking in, so that we can have you know, an effective replanting plan for the future. So I did hear about that, and any way that we can help as the Shade Tree Council to make sure that doesn't happen again, we're all about. So
very good. Any other public comment, John?
On that tree that fell in Fuji Park and took out Panda Kitchen, Marina may have more, but I checked with Parks and Rec after it happened, and they had been working on that tree for up to maybe 3 days before they had checked it. They had done safety pruning on all the trees in that park within a couple weeks. High wind, rain, act of God. Nobody knows why that limb came down, but it was 3 a.m. and that was good.
Very good.
Thank you.
Any other public comment? Anybody want to weigh in? Anybody? For the board comment? I don't hear any. Thanks, Kyle, very much for the update. Go back and do good work and say thank your board for helping out in an important part of what makes the community look a lot better and healthier.
Cool. Thank you for your time.
All right. All right. Let's take up the District Attorney's Witness Guide. I see we've got the DA here and his assistant, Mark Kruger, and also Frankie is back there. Is she going to join you, Frankie Haynes?
Yeah. Hey, Mayor.
Good morning.
Good morning. How's it going?
Going all right so far,
Good.
man.
Well, this will probably be my last time presenting something as the DA, so I'm going to take a few minutes here, if you don't mind.
Take what time you need, man. Go ahead.
Well, first let me start.
You can tell us about Go Rock, too, so.
You want to hear about that?
All right, go.
All right.
How are your calves?
Still a little beat up. Thanks for pointing that out. So I'm excited today to introduce you to our new program, our latest program that helps victims. And I thought it was great that Dr. Pintar brought up the issue with the SART program. That's been a battle that the sheriff and I have fought for 8 years. And there is somebody that I'd like to recognize in our fight to protect victims, and that is the sheriff. He's been lockstep with us the entire way. You know, when I look back at when I got elected to BDA, there was no victim services at all in this community. And now we have 2 victim witness coordinators. We need them. Our numbers are tracking higher than anywhere else in the state. We have a sheriff who supports us 100%. He's out there contacting us. His guys are contacting us nonstop for victim services. And so today, I'm just introducing to you one more component that we're bringing and that the Assistant DA is heading up. Just to brag a little bit about our victim services, we have been recognized by the National Red Cross for the services that we provided with regard to the shooting at the business here in town. That's how we do it now. And we also were recognized by the National Organization of Victims Assistance, which actually provided us with free training, and Frankie is certified in over 3 programs that are recognized nationwide. And so I want to strongly encourage the board to push whoever is elected DA or to push the sheriff to keep these programs going, because, you will never, as a board member, realize the impact you have on a victim's life until, and this was my greatest claim, if you will, a murder happened when I was 11 years old in this community. And I personally prosecuted that case in 2006. And when that mother put her hand on my face and said, "Thank you for all you did," that changes your life, and sorry for getting emotional, but it changed my life. And so when you do stuff like that and you stand up for people who are hurt, it makes a difference. And so without further ado, I'd like to introduce the Assistant DA, Mark Kruger, who's heading up this program for the DA's office.
Good morning, Mayor Kroll, members of the board. My name is Mark Kruger. I'm the Assistant District Attorney. When you talk about the courtroom, it's a search for the truth. So it makes sense that using dogs in the courtroom provide comfort and reassurance to children and other vulnerable victims. It allows them to open up about what happened and why they're there to testify. The District Attorney's Office is really pleased to introduce our District Attorney Witness Guide Program, or what we like to call DAWG, D-A-W-G. We have Subaru here, who's handled by Megan, one of our employees. Subaru is a canine who's trained as a therapy dog and who is acting as our witness guide dog. Subaru is the thing that you've probably noticed while you've been sitting here, is Subaru has laid quietly in the background, barely noticeable. Yet, Subaru provides that kind of level of comfort to children, to vulnerable victims, that's necessary to get them through the traumatic process. And we're talking about serious crimes, like victims of sexual assault. I was prosecuting a crime against a perpetrator who had victimized a little girl that was 11 years old. She didn't have anyone in that courtroom, and she was having a very, very difficult time. And I hit her with a question of, what were you thinking about when he was doing these things to you? And it stunned her, and she stopped and paused and broke down and started with this words flowing from her mouth that I put myself into a fantasy land and I had a pet dragon, and the dragon's name was. And that's what's important here, is that pets and animals have been used for a long, long time as therapies. In ancient Greek, they had horseback that they would put sick people on to help them. In the 1950s, I saw a photograph as I was researching this, that they had by the bedside bed in hospitals a barrel of ducks swimming, the theory being that pets do actually calm anxiety and help people. And that's what we have found, that in looking into this program and starting it, that this will be something that will help children, vulnerable people, victims of domestic violence, be able to get through the process. So what's the process? Well, Neil talked about Frankie Haynes, our victim witness coordinator. Between Frankie and I, we've had over 30 years of combined experience prosecuting child sexual and abuse cases. It's anticipated, and what we plan on using, and we've already started using Subaru to do, is to assist victims of crime in forensic interviews, hopefully utilizing the sheriff's detectives, greeting children and parents as they come in, providing that level of comfort as they go into the process of meeting with victim witness services, accompanying the witnesses, including victims, during all phases of the prosecution, including preliminary hearings and trials, and even greeting members of the public at the courthouse, providing that friendly welcome. And then providing emotional comfort to family members, but not just in these types of crimes, but also crimes like homicide, where you have the victim's family who's left and needs help getting through the sentencing phase. Finally, it provides normalcy in juvenile matters. Now you ask, are dogs in the courtroom legally neutral? And the answer is yes. We've done the research. We are very fortunate in Nevada to have NRS 178.571, which provides that a witness in these types of, or victim in these types of crimes has, under the law, the ability to have an attendant with them. Now, the legislature took very careful steps not to define an attendant as a person. They did so in other sections of the law, but not in this one. So very much an attendant can be Subaru, and the dogs like him. We support this. The District Attorney's Office and Victim Witness Services support the use of this program, and we're very pleased that we're bringing it on board. we know that the defense may have some objections. They may say it's prejudicial. But courthouse dogs and Subaru, they're for everyone. They're for all witnesses. And since 2003, throughout the United States, the use of courtroom dogs has spread. Currently, right now, there are 69 dogs in 25 states being used as of July 7th, 2014. If we can get the courts to allow this dog, Subaru, into the courtroom, we will now make it 70 states because Nevada isn't represented. So Carson City, again, is now one of the first. And we're the first city, first jurisdiction in Nevada to bring this program. We looked at the appeals on these matters. The Court of Appeals are upholding the use of dogs in the courtroom. They're saying it does not create an overly sympathetic victim. So how does it work? That's what I asked myself, and I did the research. He's lying quietly. It only takes a simple command that Megan can give him to lie quietly. He's pretty much virtually unnoticed, but his mere presence reduces anxiety, relieves stress, and helps these victims face their perpetrators and tell their story about what happened. Tell the events that led them to have to, unfortunately, be there that day. And so the courts are upholding the use of these dogs because the dogs lay quietly in the courtroom. And finally, you take another necessary step for protection and you give a jury instruction when it goes before the jury saying no consideration should be given to the fact that this dog was in there. What about the cost? Well, we're pleased to announce that this program that we have has no cost associated with it. How is that possible? This dog's owner is a local community member. She happens to be an attorney, and she saw that Subaru could help people, and we approached her we were connected through a mutual source, and we found that she could enter into a simple agreement with us, which we've done through our civil division. The contract's in place, it's a volunteer agreement, and we've even made sure that we have liability insurance in place. We're covered. So what's next? Well, we're going to go to the judges and we're going to request that they allow the use of the dogs in the courtroom. This isn't just for the victims either. Remember, they're for all witnesses. We anticipate strong support from the judges, even in using Subaru in mental health court and in drug court for defendants. And we're going to ask for your support, and we're asking now for your support to support us in this program. We're proud of this program. We're proud of the District Attorney Witness Guide dog. And we're confident this program will make you proud and the citizens of Carson City proud. And thank you. And if you guys have any questions, we'd be happy to help answer.
Thanks, Mark. Board questions?
Mark, you didn't mention the juvenile court. Will you go to them also?
Yeah, and I thought I had mentioned just
No.
It provides normalcy in juvenile proceedings. It really does. And yes, of course, they would be incorporated.
I think it's a great program. I think that you're absolutely right that the calming effects, the strength or the support that an animal will give the witness, especially young ones, is probably something that's missed out, will make justice more just. The mayor and I have a disclosure. We've known Subaru since he was born. He attended Rotary quite a bit. Subaru is part of a program that a gentleman at Eagle Valley Middle School, a teacher, Warren Wish, our counselor actually, Warren Wish, has created, and I hope the program's ongoing. But you'll see these animals all over town, and Subaru, I hate to say this, dropped out of blind dog school, so.
Well, that's service dog school, but he is certified through Intermountain.
Oh, I know that. He's just,
as a therapy dog, and there's a difference because service dogs fall under a different section of the NRS, and they actually provide service for disabilities. And he dropped out not because of any defect really only that he has a small drooling problem. So
I just want everybody watching that doesn't know about service dogs. These dogs are not your typical labs. They are very, very calm.
Yes, thank you.
Mark, are the therapy dogs allowed to go up on the stand with the witnesses when they testify, or are they kept back during that portion?
Through my research, I've determined that they're allowed to sit up at the stand, but what really drives that is the law itself. NRS 178 provides that the animal, the attendant, in this case the animal, Subaru, is able to stand right next to the victim when they're testifying, or if the victim chooses them to be somewhere else in the courtroom, somewhere else, just as if the attendant was a person. So it's really driven by the wishes of the victim. As a practical matter, we've noticed that having the dog closer provides that more comfort. So it would be anticipated they'd be up on the stand, kind of akin to a service dog, but in this case a therapy dog, in that they're sitting here, or what we call a witness guide dog, because that's truly what they are. They're providing that witness comfort. And so, yeah, right up on the stand. The ways to also keep it so that it doesn't have any kind of prejudicial effect would be you can clear the courtroom of the jury, bring the dog up, have the dog laying there, and then the witness there, bring the jury back in. So those are ways that other courts have handled this matter.
Hi, Mark. With the busy court calendar, how are you going to prioritize Subaru's schedule?
Well,
We'll get two.
Most of these particular types of cases tend to be a little bit longer in proceedings. They're crimes of secrecy. So you don't have a lot of other witnesses other than the witness itself who's testifying, and they generally take a little bit longer to go through the testimony. Now, unfortunately, that also relates to the fact that in generally most of our cases we see the abuse has been perpetrated over a longer period of time. It's going to be fairly easy to prioritize it as far as the vulnerable victims, using them first, and then utilizing them in the cases of domestic violence. Naturally speaking, we think that the benefits are more for the smaller kids, but not saying that it's any less for the adults. It's just priority-wise. If we have a conflict, that's how we would do it.
Anything else?
Let me just.
You guys want to meet Subaru? You want to take a minute?
Yeah, before we do that, though, there's one other thing that's coming up. You're a constitutional officer. You have access to the legislature, but the city's going to be putting together its legislative program, and there are some needs for young victims and sexual assault victims, I understand, that maybe we ought to talk about and get on the, get the board to put backing to get this to the legislature.
Sure, I would love to talk about that. There's a lot of...
We've got to be careful. I mean, I understand, it's a great idea. I just call everybody's attention that September 1 is a deadline for card boards, and so we ain't going to make that one unless we go for a Saturday meeting, which I'll be happy to do. No, well, it'd have to be a Sunday meeting, because I got to have 3 days.
Right, it would have to be.
Sunday meeting.
What I was thinking of, Mr. Mayor, is the city has we're part of a county lobbying group, and that group presses issues, discusses issues, that sort of thing. I was thinking more of that group.
Sure. Well, I think hopefully the opportunity will come up. Neil.
Mayor, I'm sorry. I am working with the AG's office on several of those issues, and I can sit down and we can talk if you want. We're the AG's General Masto's done a good job on these issues and stuff. So I think, you know, we're okay. But I'd be happy to sit down and show you her package that she's presenting and go from there. You know, I worked on the trafficking lobby last year for children to protect juveniles and things of that nature. So whatever thoughts you have, if we can't get it through Carson, as a constitutional officer, I can get it done through her office or work with her, and we can do things like that. So
I think it would just be a good opportunity for you to disclose to everyone what the problems are and what you're working on.
Okay. Other comments of the board? Public comment? Anybody? Then we'll take a brief recess. No, we won't take a recess. We'll just be in place for a few minutes. Frankie, did you want to say something? Anything? You sure?
We Would you mind if we got a picture of the supervisors with Frankie and the dog and just?
Not a problem.
Would that be okay?
Not a problem.
Maybe up there? Yeah, sure, if you don't mind.
Come on, Subaru.
Huh?
I was gonna say, man, if the judges turn it down, I could use with me at the board meetings.
Right, there you go. We'll put him in your lap. Hey, Frankie, will you get up there too? I think I'm gonna be the cameraman. Okay, you guys ready? One. Hey, don't get your flash in my flash, man. 1, 2, 3. Got it. Thanks, guys. I appreciate it. That's probably the better picture. Yeah, S-B-A-R-U. Yeah, same way. Yeah. Right.
And so he was dropped for that, but she recognized that with his personality, he would be perfect for this. No. I'm just showing you guys. Advance to advance.
Child, maybe 1 or 2 years old, is autistic, and it was just really amazing how that dog, would calm that child down.
Hey, Mayor, can I make one more comment? I should have, Megan McCoy, who's the trainer, is also the daughter of Kevin McCoy. And she's, just to connect things up. Does a great job for us.
Very good. All right. Thanks, Neil, again. Thanks, Mark. Okay, and Frankie, thanks for all you do. I know, you didn't say anything, but you're the kind of the unspoken hero over there, so.
Thank you, Mayor.
Okay. All right. Okay, let's take up now, should we do the quarterly business review? Nick, you want to take us through that one? Or who's doing that?
I've got it, Mayor.
Oh, you got it, okay.
I got it.
All right, Marina. Telling you guys
So-
to have it. Yeah, go for it.
I'd like to present the quarterly business review, and I will have the directors that are here come and present their piece of it. Just to give you a quick introduction, we had this scheduled for June, and I just realized I didn't update this first slide. We're going to have some information. I apologize that it's a little bit disruptive this way. Some information will be through March 30th because that would have been the normally quarterly review, but because for other circumstances and very busy board meetings, we were delayed until now. Some departments were able to update to the end of June, and others were back at March. So it's a little bit disruptive that way. Again, I apologize for it, but we'll go forward and do the best we can. The first one that we have here is with Cooperative Extension, and Joanne Skelly wasn't able to make it here today, but she had one slide that she wanted to present, and this was Farm Days. that was held in April this year at Fuji Park, and it's done in cooperation. The Cooperative Extension hosts it, and they get entities from all over that come and show different types of agriculture in Nevada, everywhere from livestock to farm equipment to crops that are raised, and it's a very well-attended event that's done, invited all the school districts invited, as well as private schools, as well as other child care or type facilities, and they will come tour through, and it's always been a really well-attended, essential program to teach the youth about ag in our state. So that's her slide, and with that one, we'll go ahead and move forward. There's another one, sorry, there was that. And that, as you can see, they're talk about where the food comes from, where fiber comes from. So they had 1,300 students this year, lots and lots of volunteers, and several presentations, again, all around ag in the state and how that benefits all of us, really. And if there's not any questions, we'll move on from there. And we're going to have the library next, so Sina will come on up.
Good morning, Mayor, Board of Supervisors. Sina Lloyd for the record, Carson City Library Director. So what you'll see, you can go next slide. There we go. Our library usage, I have in here from July of last year, so 2013, through April, is pretty steady. The registered patron number did drop some in September, and that's when we do every 5 years, we do a clean out of patrons who haven't used their cards in that 5-year period, and that's what you see there. And you'll see that our reference questions for youth and for adults pretty much stayed the same. In April, we had 1,364 questions for youth and 4,691 questions that adults asked that we were able to answer. And then I'm going to go through with this next, essentially, slide that our strategic plan for 2014 to 2019 gives us 3 goals, and one of those goals is to create opportunity. And by having the library open, by having patrons coming in and using the library, they're being able to access knowledge, they're being able to have fun. We do a lot of programs with the youth. We do workforce training and computer training, and then there's the access to technology piece. We also have access to ebooks, and as you can see, our user numbers from fiscal year 2012 to 2013 to 2014 at the end of May, our user numbers and our number of checkouts of electronic materials has risen significantly, and this is just with our Overdrive platform. We've added many, many different books. Right now we're up to about 3,000. There's fiction and nonfiction books in there. There are some test-taking books, so if somebody's taking a civil test and they want to practice and they can't find a book to check out, but they have, let's say, an e-reader, they can check it out that way, or they can even use the computers at the library, check out the book, and read it on the computer at the library.
Got a question for you about that. I got a Kindle for Christmas. I have an iPad that sits there. Can I access the library and get books for those, or do I have to continue to go through Amazon?
Nope, you can. Absolutely. Do you have a library card?
I might be one of those 5-year dropouts.
Okay. Well, if you come in and get a library card, we can definitely show you how to do that. On an iPad or any tablet device, there's an app that you actually download, and so you don't have to keep re-entering your library card information. You just go to that app, see what books are available, and then you're able to check them out or put them on hold, because we do have a minimum number of licenses, so somebody might have the 2 copies checked out, but once those are checked back in, you'll be able to check them out. And the beautiful thing is they will never be late, because after the period of time, it will just check it back in for you.
So the other part of this is I like electronic toys, so I probably have too many devices and I might need to get rid of some. Is there a way of recycling tablets, et cetera, so that people that don't have access to them can use the old one so I can have the newest one?
There are a couple of companies in Carson City that do that, but we would be more than happy to accept a donation of a tablet or a device and use that through our program. We do check out Kindles as well, so patrons can come in and check out a Kindle, read some books on that Kindle, and then return it. We have the latest hot bestsellers on those Kindles.
Just a quick question on the usage, when it says feet in the door, it's kind of maintaining or dropped a little bit, am I looking at that right? From 30 to a little above 20? Is that in conjunction with the e-book usage going up?
It could be. I would say that I would have to look at some of the past years because we generally average about 25, 26,000 if you average it out for an entire year. We do have more feet in the door in summer. That's usually due to our summer reading program and the increased number of kids coming in and using the library during that time. But I have not correlated that to the ebook use as of yet.
Okay, that'd be curious about that. Okay. Thank you.
On a facetious way, you have a thing here called library usage questions answered. Are those questions answered correctly, or are those just questions asked?
Questions answered to the patron's satisfaction. Okay, so then we have programs and partnerships that we're doing. One of the ones that I'd like to emphasize, especially since Subaru is just here, is we do have therapy dogs coming into the library, and it's called Love on a Leash, where kids are able to then sit down and read to the dog. And they're not just labs, they're all kinds of dogs, but they are registered therapy dogs. And this allows kids, especially with dyslexia, to read in a very comfortable environment that's not judging them. And we have seen improvement in some of our students that come in and use that program a lot, that their reading levels do increase, and they're doing better in school because of that ability to read to the dogs in a non-threatening environment. We also had Discover Tech Engineers Make a World of Difference at our library in April and May, and a couple of you did come to that opening, so thank you. We ended up having, during that time period, just attending the events involved in Discover Tech, we had over 4,000 people coming in the doors of the library. What you see in this picture here is an egg drop contest that we did, where the kids were given, essentially our auditorium was just full of anything and everything you could think of, and they put together a package that would protect an egg, and then we dropped it off the roof. And some of the kids' eggs survived, some of them didn't. Some of them tried again and tried to make different packaging and protect their egg. This one was made by, she's entering, she'll be a freshman this year. Her name is Shayla, and her parachute worked. So it was pretty impressive. And then we also had the GATE program coming into the library, as well as us going to the school. And so we participated with the Mark Twain Elementary School and Carson Middle School on that. And then with the Carson High School, Miss Fagundas's Honors World History class, we participated with them in teaching them how to make a documentary and then helping them with research for one of their National History Day projects. And we're proud to say that one of those students did go to nationals at the end of June and came away with an honorable mention from Washington, D.C. And then the last thing I wanted to talk about is computer use and training. And this is part of our facilitating connection in our strategic plan. And what you'll see here is our Wi-Fi minutes used. They're at the top. We have, generally in the winter, people don't want to sit outside when it's snowing or cold to use their computers, and our usage does drop. But in the summer, it does go back up with people and their devices using the grassy areas by the library, even when the library is not open. And that's about 25,000 Wi-Fi minutes. And then our computer hours used, you can see, is pretty steady at about 5,000 hours each month. And our computer training, thanks to a grant that we received from the Library Services Technology Act for the state of Nevada, we were able to train city employees as well as regional patrons. So patrons from Lyon County were trained in this process as well, and also patrons in our community. And the city classes were very popular, and we got lots of positive feedback from those. And we are looking to see how, without the grant, we might still be able to facilitate some of those classes specifically for city employees.
Sina, how many computers are available at the library now for the public?
We're right about, with devices included, right about 100.
The number of devices that you would use to calculate the 5,000 hours a month? I'm just looking for an average per computer.
It's about 26 computers.
Okay. Thank you.
Okay.
If you include McKenna, he's bootlegged 20,000 hours.
Question, Sina? Just a curiosity question, how the reorganization of the space is working for you since the Friends of the Library opened up their own space?
I'm glad you asked. We are opening the Digitorium in September, and this is a space that will be used mainly by freshmen, but also by other teens. And what that's allowed us to do is increase the capacity in that space. We have, from the Library Foundation, received money to purchase MacBook Pros, and so there will be 20 MacBook Pros in that space, as well as booths for the kids to use to interact in a non-threatening, non-school-like environment. And then our stage is a complete green screen at this point as well that they can use to do school projects and everything. And we're really happy with how that's working out. There's been a little bit of kinks with getting some of that all finalized. And that was the last thing I was going to talk about, was thank you to the city for our elevator, which is now in operation. And that means that patrons can be going upstairs without having to use the stairwells. And it's just, everything's flowing a lot better. We can actually move heavy items upstairs that we couldn't before. And I wanted to say thank you to Dave from the fire department with all of his help getting our burglar and fire alarm set and all of the issues that we were having with that done. And so we're getting there, and we're good to go at this point. So
What about the roof?
the roof is not leaking, and it hasn't leaked through all of these thunderstorms. And there was a smell that patrons had complained about. So far, it seems to have burned off at this point, but until we get some higher temperature days, I'm not sure if it will come back.
But you still need a new one, right? No?
No.
It's working
Yeah,
fine?
it's
Okay.
working. Yep. Is there any questions? Other questions?
Library directors are always so erudite. That's very nice. Okay.
Good afternoon. Sheriff's Department, we're cautiously optimistic about what we're seeing right now for the last quarter, and I will note that Brad asked at the last meeting, what about 2013? The public safety did finally produce. They do the summer following the year. 2013 ended up being one of our best years. It was our best year in the last 20 years by the present reporting data mechanism. We not only had a crime rate in Carson lower than the regional rate and the state rate, but also lower than our trend data would have suggested. So Carson as a community just did an extraordinary job last year. And that kind of sets a standard or a benchmark for what we're discussing right now in the quarter. Not wholly surprising. Summer months tend to bring everybody out and sometimes have a little bit too much fun. We are seeing an increase over the quarter. It is not wholly alarming to me. As you'll see right in this slide here, our crimes against persons are holding relatively steady with past years, and our property crimes, I'm very pleased that are lower than expected.
Can I ask, I'm sorry.
You certainly
on
can ask
the,
anything.
Carson City crime rate at 19.35, can you kind of briefly describe what that means in ratios?
What that means is crime rates across the country are based on certain crime criteria. We call them Part 1 crimes. They're your most serious offenses. Those include your homicides, your rapes, your robberies, your aggravated assaults, burglaries, both commercial and business, auto theft, and I think we are still counting arson as one of our Part 1 crimes. When we calculate a year end, you take that total and it's divisible with the population of the community, which the population that we use, as you heard earlier, you can go anywhere and get a different population. We use or the state uses the University of Nevada demographics charting, and Carson City is faring extraordinarily well in that.
I think on the crimes against persons increasing, is there a reason for it? Is it just an aberration? Basically, the question is anything we need to do.
As I was sitting here browsing over a lot of the data while Marina was being so gracious and bringing over the pointer, it's not alarming to me. While crimes against persons are seeing a general trend upward, during this quarter, we also saw us reaching one of, or equaling a lowest point since 2003. So it's something that we watch. It's primarily the simple assaultive type behaviors, the pushings, the shovings, the I got you in the jaw type of things, not wholly serious crimes, but those are affecting those numbers. And as we've reported in the past, that type of behavior, call it your barroom behavior, tends to be the single biggest impact in our crime ratings here in Carson City.
I don't know where this fits in, but what about gangs?
Glad you mentioned it. We've been extraordinarily successful over the last 4 or 5 years with gang activities, reducing in Carson City. That is not to say that the Sheriff's Department is not as busy as ever. The Tri-County gang operation with the endorsements of Sheriff Vale over in Lyon County and Sheriff Perini down in Douglas County have been tremendously successful at stemming the more violent offenses. As far as the on-the-street activities, the gang unit is as busy as ever. They have been over the past couple of weeks, and in fact, we just saw a small episode. I would say in the end, it's probably going to be a small episode avoided by some very rapid reactions by not only our folks, but the Tri-County Gang Unit and Nevada Highway Patrol all merging together to make sure that nothing did happen.
And as long as I'm just monopolizing time, I understand that there's a red truck in Silver Saddle Ranch up on the side of the hill. Have you heard about that, or? Okay, we'll talk later.
If there's a red truck up on Silver Saddle Hill, it certainly poses us with some challenges. We normally look at those types of incidents and kind of balance out the outcry versus the damage that would be done to pull it out or not.
Yeah, somebody just mentioned it to me in my travels that I haven't heard about it, so.
Sorry about that. In closing, I would point out that while we tend right now to be at about a 10% below last year's numbers, suggesting we're going to have another great year in front of us. This slide up on the screen at this point right now suggests to you that our call volume is steadily increasing. That should be a flag of caution for the future. If that trend continues, then obviously you may see a turnaround or some years that aren't quite as good as what we are experiencing right now today.
Kenny, explain to us how the call volume goes up, but the crime rate goes down. How's the breakdown work there?
Remember that the crime rate is based on specific key crimes, the more aggressive, more offensive crimes. That is not the total crime. There's a second phase that is not very often spoken about, and that's our Part 2 crimes. And I do think that is significant because Part 2 crimes, in conjunction with the Part, and we do monitor that activity, that goes to the quality of life in Carson City because that's going to range all the way from your homicides to your juvenile runaways. And your juvenile runaways has always been a key indicator to me of the quality of life here in Carson. If you have juveniles running away, then we have some problem that we need to isolate and address. So the Part 2 crimes, that list, the frauds, the drug use, the alcohols, the DUIs, these lesser offenses are included in your overall crime. Even those numbers are down slightly from last year. Does that answer your question?
Well, sort of. What is making up the increased calls if it's not the serious crimes?
It would be, a lot of those that increased calls would come from that Part 2 crime offenses. Your lesser offenses, we are significantly viewing fraud, and maybe I can use this opportunity to tell the folks in this community, these scams of you have a warrant, you haven't paid your bill, or whatever the case may be. When people contact you on the phone, please, please, please hang up the phone on them. No law enforcement agency in the world is going to call you up and say you have a warrant, come on down so we can arrest you. We're just not that efficient. Karen. They have been far-reaching, all the way from subpoenas to the courts, tax-paying scams. The most recent one we aired out just recently was the undersheriff, Steve Albertson, was asking you to pay fines. And while most of our folks are being extraordinarily diligent, some of these scams are causing a huge alarm, especially to our senior citizens. When I sit in my home and I get a phone call and they know what kind of car I'm driving or what color it is, then I feel that somebody's watching me. And we had that those specific circumstances last week. So while we are seeing a great amount of information going out and the public is grabbing it, there are still those that fall prey to your grandson's in jail in a foreign country and needs bail.
So those types of crimes like scams, do you think that those are tied to economic conditions? In other words, do you think that you'll see a decrease in those types of crimes as the economy improves? And do you see those types of crimes go up when the economy is doing very poorly?
I don't think that those types of crimes are tied to the economy at all. They're tied to the internet. And that's where it's most challenging for law enforcement. Many of our victims are businesses or are persons. The source of the scam may very well not even be in this country. And while I can throw out 1,000 phone calls, if I get one taker, I get money. And so I don't think that is necessarily tied to the economy. That's tied to the anonymous callers or pranksters that are really targeting select groups. And we see the group that is most vulnerable is our senior population. They have the biggest heart.
John and Karen.
Dispatch sheriff's calls climbing steadily above expectations. Does that mean that you're going to need more cars, dispatchers, radios? Are we going to have to put money in the sheriff's department?
I would love to say I need more cars, dispatchers, radios, and cops and all that, but I'm not going to. Keep in mind that I said up front that our UCR crime rate, our community crime rate that the nation looks at, is at its lowest point in 20 years. The folks that we have out there doing the job right now are doing an extraordinary job of managing and focusing in on driving crime down. By driving crime down as a philosophy, then one would tend to think that you can manage those with the resources that you have. I believe that working closely with City Hall, working closely with the community, I apologize for National Night Out, but I did not want to destroy the park. I think that working in partnerships is what allows us to do the best we can with the resources that we have.
Ken, my question is, how do you, with these scams going on, something that I watched on the news this morning was these SWAT team scams where apparently 911 calls go in that there's a shooting at some location and it has something to do with some internet scam basically, and the SWAT teams are dispatched. They come in with guns and somebody's just playing video games and nothing's going on. How do you protect yourself against so that you're not unnecessarily sending out folks?
That's a real balance, and the scam that she's referring to is, again, it's actually an internet game where the callers can disguise themselves, disguise their location, disguise what they're doing and how they're doing it, and we have received them here in Carson. Our dispatch center will receive a 911 that there's a shooting going on at a particular school. That's extraordinarily alarming because our response in and of itself can endanger the public by the speeds and the volume and such. But we have very, very strong communications with our key areas in town, such as our schools, that we can, in most cases, draw an immediate verification of whether or not there is something going on. That doesn't stop us from responding, such as Stacy would say with the fire department. You've got to err on the side of caution and provide those services. But that particular scam is extraordinarily time-consuming for our agencies to monitor and attempt to find the person who's initiating it.
Anything else? Is that it, Sheriff? Always very competent, Sheriff. Thank you. All right, who's next? HR?
Those are my dispatchers. You can have it now.
Melanie Bruchetta, Human Resources Director. You can go to the next slide. I only have one. Basically, this shows you our employee count as of May 29th, 2014. The total number of positions we had open between January 1st and May 29th. The number of hits to the website and the number of applications received. But in addition to that, I'd like to talk to you about two other things. The first is that we have a joint recruitment for firefighter paramedics going on right now with North Lake Tahoe, North Tahoe, and Tahoe Douglas. And so far, we've received approximately 91 applications, and the testing will occur the week of September 22nd. And it's because of Stacy's cooperative relationships with our neighbors that we're able to combine the testing for all four agencies and save costs. The other thing I'd like to share with you is that the city is looking into offering a Medicare exchange for our Medicare retirees. Currently, our retirees are required to stay on our health plan, or they can go off and find a supplemental plan. We're considering entering into an interlocal agreement with the state which offers a Medicare exchange for their retirees. So I hope to bring that forward to you soon. Both the Attorney General and the DA's office have signed off on all the legalities.
Thank you. Darren? Mr. Schultz? Good morning.
Sorry. You awake? Good morning, Mayor, Board of Supervisors. Update here in Public Works. Not much has changed. You can forward the slide there. Thank you. You're very good at that. And I want to compliment Marina. We throw a lot of this stuff at her in all different angles, and she puts it together. It all fits. What we sent her didn't. So, not a lot of change in these measurements that we have for Public Works as far as arsenic, uranium testing in water. For the most part, they're generally going up. That's not a surprise. That's based mostly on the drought and the fact that we're depleting our groundwater slowly, and more of that arsenic and uranium is going to get into our wells. So we're not surprised nor alarmed by this. We're monitoring it, and we continue to blend our water to make sure that it's safe for everybody to drink. The wastewater reclamation plant, as far as our outflows, that's something you're also aware of, and that's been decreasing over the last few years, and it continues to decrease currently right now. Just if you look at the last 3 months, it's not on this chart, but it's decreasing a little bit, but it started to level off, which is also what we expected, and we anticipate it leveling off and then eventually start to tick back up as the economy, things come back, and we start using more water. As far as our testing down at wastewater, we stay right where we're going to need to be. That one loop is the failure that we had last year. So, next slide. Jack ridership, you had a presentation on this just the last meeting regarding adding service hours into the evening, and we're going to start that next week. That will be in the newspaper this weekend announcing that. Ridership on Jack has increased, continued to go up. We don't see the curve as it was going up almost exponentially. That's dropped off, and the ridership is slightly increasing now as we move forward from year to year. Eventually, depending on what programs we add or detract from Jack, will affect how whether or not that continues to go up or levels off for the most part. So, any questions?
Wastewater, treated effluent, we're still mixing fresh water with it?
We are still.
Where are we at on?
We're going to make it through the year, which is the good thing. We're not going to run out, but that is based on meeting, combining treated water with our effluent down to our Stewart's ponds, right around 750 to 1 million gallons a day. Within the next couple of weeks, we anticipate backing that off and not adding so much to that. But at the same time, during the presentation, we have to continue to send water up to Brunswick to make sure that next year at the start of the watering season, we have the minimum we need up there to get us through next year. So yes, it continues and we're monitoring, but I would anticipate within the next couple of weeks we can start dropping that back off, getting away from it.
Darren, watering the golf course and parks and so forth, effluent, potable water, where are we at with that?
Right now, the only thing that is being watered with effluent is golf courses.
How are we getting along with the oversight committee?
Very good. We haven't. We had we had several meetings at the beginning of the year based on our budget, and then also on the effluent issue. We haven't seen a need to get them back together again, so they're just standing by.
Jim.
The prisons, and what water are they being allocated?
The prison farm
Right.
down south they are first on the list as far as taking water, and they're right around the 1,100 acre feet.
I meant affluent, portable, or what water are they receiving, I guess I should have said. Sorry.
It's the Stewart ponds down south where we are introducing potable water to our effluent water, and that water is what's going down to the prison. So when you look at their total consumption, they're probably about half of their water is well water and half of it is effluent, give or take.
We're going to be off. I mean, this is an issue that I know that the oversight committee's looked at, and I think that we're supposed to be. I mean, their recommendation is either be off potable water or something by the end of next year or by next summer, I think. Where are we on that? I mean,
their recommendation to come back to you, and what they were in favor of was not going off of it, but that the payment of it, the payment of buying that water needed to be appropriate because of what was going on with the golf courses, we've kind of been on hold because we didn't want to put a plan into place moving too far ahead if all of a sudden things changed. But we can discuss that, whether or not it's time to just bring it back and go forward. Okay.
The other question would be, when are we going to tear up Solomon and start that pipeline?
It's a good question. We ran into a snag on all of your favorite project, East-West, and due to new requirements that were required based on federal funding, any material that we use in that project has to meet a certain standard with regards to American made. That standard changed very recently. Luckily for the city, we got the new standard in our bidding documents. But unfortunately for the vendors, they're not prepared to meet those standards yet. So our butterfly valves, big 24-inch butterfly valves, we cannot get those for 6 months. So that project is now delayed. It will start likely in March of next year, and we'll get water as soon as we can based on that change. So it's the project that keeps on giving.
Darren, how have the golf courses done in staying at or below their allocations this year of water?
They have done very well. Not below, at.
Okay.
Not above.
Okay. Thank you, Darren.
Thanks.
Lee? Mr. Plemmel?
I took control from the sheriff of the presentation. Next segment is the Community Development Department, and good morning. So I got a couple slides just to go over here as I have in the past presentations. So the first issue in community development is building, planning, zoning, redevelopment, code enforcement, but I'm going over just a couple things here. What we're looking at here is a graph on the building permit valuation, kind of a measure of general overall development, building activity, construction activity in the city. This is the last 5 years up to the complete last fiscal year of 2013-14 on the far right. What you're looking at on the bottom, the base, that yellow color is residential construction. Obviously back in the 2008-2009 range, residential construction dropped sharply. Over the last 5 years, you can see it hanging down fairly low. We have seen definitely last year an uptick in residential construction relative to the recent past years, and that is continuing so far this year. That continues this summer as new residential construction in, and as you've recently seen new subdivisions coming in for final maps, ramping up for more construction. So we expect that to continue. You see there's kind of a fluctuation over the years, and the next color up there is commercial, so that can, a single big project that's new commercial construction, a single big project in new commercial construction can have an effect any given year. And then you have there's a large category at the top that's all commercial remodels, residential remodels, and just a mix of things. And, again, over the last year, we had a pretty good increase in activity. And on the building permit side, also just a reminder, you recently approved contracting services for the building official inspections and plan checks, and they will be using a portion of the revenues from these permits to provide those services. They're in the office this week getting ready. The contract starts as of next week, and they'll be in place and running those activities. We'll also be shortly sending out an invitation for a meet and greet next Thursday that they'll be putting on for that. So there'll be more information to come on that. These are graphs you can kind of see over the years also on planning and zoning applications, with the top being the total applications received and the bottom being the type applications that go to the Planning Commission. So they're relative, they're not to the same scale. The volume going to the Planning Commission is much less than the overall. And as we know, in the 2008 time
time frame, things dropped off significantly in planning applications. Staff was also reduced significantly around that time. But over the past few years, we have seen a steady increase in the total number of applications coming in that we've been processing. So we've been busy in the office with the staff that we have left. And the one on the 2014 on the far right is just a half year, so that's not a complete year for comparison. And then the last slide I have is related to the brick usage, the public usage of the computers and the brick in general by the public, with the complete data for 2012 and 13, and then a half year for 2014. And in terms of conference room attendance, you can see we're getting increased usage on that. We're on track to exceed that again. That's been it's been a good service. It's been good. There's a lot of good meetings in there. We are considering there's been some discussion that we've heard in the past about these free rooms that we have here competing with other city facilities. So we are looking at that and possibly bringing something to the board in terms of a policy as to who should be using the brick for free and maybe who shouldn't, and should be paying rates similar to what they do in this facility and other city facilities. That's a discussion for another time, but that's come up as a potential issue. We do have the computer usage in our office. They are library computers. They're library resources. They were purchased through the library by a grant and are connected to the library system. People use the library card to get on them. They continue to be used there at that facility. And in terms of classes conducted, we're still, Michael's still conducting the Business 101 series of classes that has slowed down a little bit. When they were first offered, we had a lot more usage at first. They were more frequent. We've kind of gotten into more of a steady occasional offering of these classes, but they're still offered. And so our attendance in this past year has been a little less than in the past. That concludes my presentation for community development. Do you have any questions?
I don't see any. Make sure the school district gets an invitation to your meet and greet.
We got it. Thank you. Oh, we got an extra slide in there.
No. Vanna Furlong, would you like to do this? No? Okay. Before we get to the slides that I had, both Sina and I neglected to put a slide in here because a booklet that the fire department produced debuted very late June, actually it was in July. And we developed a booklet with the assistance of some local folks, a local photographer, Kat Allison, a local writer, Terry Vance, our staff, and the library. And it's a book on fire safety that we had created into an ebook as well. And at last count, we had over 200 ebook downloads. And we did a reading day. Firefighters did a reading day in mid-July, and it was their highest attended reading day for kids at the library. So I'll interoffice you copies of the book. It's a kid's book, and it incorporates a local family. In fact, one of our firefighters' families, and basically photographically and in words depicts the key things that we want our kids and families to know. Fire safety in the home, basically. And it covers kind of all of those things. There are other booklets around, but this kind of incorporates all of that into one location. So we're very excited about that. So at a previous meeting, Supervisor Bonkowski asked about our wheelchair transport service. And this is a new measure that we put in, so we don't have a target rate. And we don't have anything to compare it to because we've only been providing the service since early in 2012. September of 2012 is when we started. But you can see it's been rapidly increasing in terms of the number of transports we've done from our wheelchair patients. We had a low right after we started the process of around 140. And our high was in May of this year. We transported nearly 225 wheelchair-bound patients between the hospital campus facilities or originating within the hospital campus. We're averaging now over the last 3 months about 190 patients a month. And that number from basically the 140 where we started to that 190, those 50 patients are patients that were at one time generally ambulance patients. So we've decreased the dependence on our advanced life support ambulances, which was one of the primary goals for me when I approached the hospital on this cooperative effort. So it's working, and I can see us expanding that into more basic life support service provision in the future. This is the next two slides are calls for service for fire calls. That's slightly up. Basically, it's been steady though over the last reporting period over the last 3 years. And then our EMS calls for service, you can see, have stabilized a bit, although it is still trending up. We're running close to about 650 ambulance calls per month, and that combined with the increase in the wheelchair transport has helped slow the increase we had here from our previous reporting. So for me, that's all I have this month. Questions?
Questions, Stacy? Stacy, I want to take an opportunity to say, I got a letter from an individual who was going through Carson City, and I think we read about it in the paper, that had a heart attack, I guess, and was going north on Highway 50 south, went across the median, ended in a ditch. And the letter from that individual says that the efforts of the fire department and others, but primarily your paramedics, saved that man's life. Literally saved that man's life.
Yeah, I got a copy of that letter, and it's very nice to get that appreciation. I sent him a card thanking him for thanking us, because we don't often hear the results. Quite often we'll transport a patient to the hospital, and if the paramedics are there later in the day, they'll pop in on someone and see how they're doing. But we don't know long-term results. People don't come back to us and tell us long-term results. So it's really rewarding to see someone like that who's back to normal, quote unquote, after that. So it was a very nice letter.
Very good. It reminds me I should probably do the same thing. So,
thank you.
John, anything?
I was talking to Supervisor Bonkowski, and he says you're going to need new fire trucks.
Yes. I feel like I'm looking into something I'm not aware of here, but I'm happy to discuss anything with you, yes.
But how soon are you going to need new fire trucks? Let me ask that.
We've been asking for new apparatus every year for the last 6 or 7 years. So the need has been there. Where it rests with the rest of the needs of the city has always been a question, and we'll continue to function within that framework. We're working right now on pricing some alternatives, and that is looking at the purchase of rebuilt fire apparatus. So some communities are still able to turn their apparatus over at about 100,000 miles. And there's a company in Las Vegas that is rebuilding those apparatus. So for the price of a new fire truck, we can get 2 refurbished fire trucks, maybe even for less than the price of a new fire truck. So we're looking at alternative ways to fund that instead of just brand new out the door stuff. While I'm reluctant to say that I think that that's the solution to all our problems, I feel like it's a real viable alternative, but I'm doing a little more research on that. We can do the same thing on ambulances. The last set of ambulances we bid, we spec'd in such a way so that the box, the patient compartment, can be removed and placed on a new chassis. That can be done for about $60,000 plus the cost of the cab and chassis, and that saves us probably 2/3 over buying a whole new ambulance. So we purposely moved to a design of an ambulance box, that's what we call it, modular in fashion that it can be lifted off and removed, placed on a new chassis, and we can use that box between 2 and 3 times depending upon the wear and tear in the back. So that's another way that we have to reduce the cost significantly of replacement equipment.
Thanks.
Thank you.
Okay. Who's next? Going to talk about security, John?
Sure. It's John Wilkinson, IT Director.
Huh?
John Wilkinson, IT Director.
Hi, John.
I do have a point or two to make about security. Can you hit the slide, please? Oh, do I do it? Sorry. I want her to do it. She does it well. Thank you. The first item is uptime, 7 outages scored at 353 minutes. 99.7%. That is a little low, actually. The way you calculate downtime is not any outage. You start subtracting that time. If you've got 10% of your customers and they're completely down for 10 hours, that's considered like a 1 hour outage because you have to do all this math. We do a simpler formula than that, but half of that outage was, or all that outage time was one single event caused by a security problem where we had a major facility, and we count that it's about 20% of our customers. They were down for about a week with a major service out. They had a lot of things going for them. Email was working, internet was working, one of their billing systems was working. Mostly they were up, but they had a major service that was out for a week, and it was due to a security problem. That is half of that downtime that we experienced. This is a full year's result that ended in June. We did finish our XP conversion project. There are a handful of computers out there. These were computers that had to be moved from XP to Windows 7 operating system by Microsoft's deadline. We have 4 or 5 still out there. They're hardened, they're isolated. They provide services that we cannot get. We cannot move these computers to Windows 7, so we just protect them, and so we're pretty comfortable with that.
Windows 7 has to be replaced in 4 years?
No, sir. We're good until 2023 on Windows 7. The next bullet point is 3,875 work orders. That's a large increase over 2013. A lot of that is we are counting better than we used to count, where everyone is more attuned to performance metrics than we used to be. And so we're more effective at counting all of our work orders. But a good chunk of that is increased workload. Anything that we do projects all the time. We do a couple of dozen projects every year. After those are done, we're still responsible for keeping those going. And the list never gets smaller. It's just things kind of get piled on. But we specialize in automation, so we're supposed to be able to do more with less. We're the specialists in that. The last bullet point is, I think it's the most important. It's my favorite, and that is customer satisfaction survey. We scored 3.9. I tend to do these surveys. In the past, I've been doing them every 18 months or so, and I've been doing them for 14 years or so. We're doing them annually now, and 3.9 is an okay score, but the trend is a little troubling because it's down from our high point last year where we were 4.1, and it is really hard to move those up. You move those things up in increments of 1/10 of a point year after year for a couple of years, and then to see it drop off, that's a little disappointing, but still that's not a bad score. Which one is it? Thank you, ma'am. Our goals for 2015 is 99.9% uptime. That's not unattainable. We'd like to get 20 projects completed. These will be at the city manager's discretion as to whether or not something qualifies as a project. We want to get our customer service score up to 4, and we should be able to do that. On those projects, we do 2 or 3 dozen projects every year, and some of them are small, some of them are pretty major, even though you may not hear about them. One that we completed recently was a voice logger recorder system for the dispatch center. It's their project, but they count on us to install the equipment to help them get it going. We actually help them in the selection process of that. That's a $125,000 project, and it was basically removing all the old stuff and putting in the new stuff. Some of the other projects that we have, to implement a security policy and a usage policy for HIPAA. That is one of our big projects for this year. We've been working with all the departments, but specifically Health Department, on getting that going, and we're going to be presenting some policies for consideration to the city manager and the technical governance committee within a couple of weeks. Senior center phones, that's one of our projects there. We are installing fiber optic cable over there right now. It lacks a few steps to be terminated. Pretty soon we'll have a connection all the way from senior center through health department down to this building. It's going to improve service for everybody when we do that. And we also have a major fiber project. Well, that's completing that fiber link between this building and health department. There's one other project that is pretty high up the list now, and that is It's called CRM, Constituent Relationship Management. It's a way of people reporting problems and the city following up on problems. So if I want to report a pothole, what number do I call, or what screen do I go to? In our case, it'll be those things, but also smartphone apps, and you may have heard from the city manager about this, where we've got it narrowed down to 3-4 different vendors for a smartphone, iPhone app, and Android app that will allow someone to just take a picture and send it in and effectively report a problem without very much effort. There's one other project that I'd like to mention. It's pretty high profile right now. It's to complete the implementation of software that we use to manage mobile devices in the city. And as things have gone towards mobility over the last 5 years, it's gotten kind of crazy. Organizations are installing software and implementing software that's referred to as mobile device management software. It'll take care of computers, mobile computers. It'll take care of iPads. It'll take care of smartphones. It's supposed to help us do everything. It'll allow us to reset a password for you. If you forget your password, we can reset it remotely. It'll allow us to push apps out like that iPhone app I was just describing. We'll be able to push that to you. You won't even have to install it. It's designed for everything that the city does mobile, but where it's getting high profile right now is we have a lot of privately owned phones that people are getting city email on. And recently, we've been stepping up our implementation. People have been getting some messages that say, well, if you install this app, you're going to be letting the administrator have access to your personal information. And that's kind of a scary message. But that personal information is really pretty benign. It's your email address, your phone, maybe stuff like, do you have your hotspot turned on, and are you in roaming? Who's your service provider? Stuff like that. What we can't get, and this is where people have kind of a misunderstanding, is we can't get any of your data. We can't look at your pictures. We can't look at your browser history or what spreadsheet you have on your phone, your text messages. We can't see a list of who you've called. We can't see any of that. It's impossible to do that with this software. It's really designed to help us manage these devices. It's not a tool for anyone to pry into any information. I point this out because that's a privacy concern for employees in the city, and we're concerned about it. And we've heard some concerns expressed about it, and I am going to send out something to all the people that would be affected by this to let them know, here's what we can get and here's what we can't get. We do have the ability to see your location. We've turned that off. We do have the ability to see what apps you have installed. We've turned that off. And you can look on your phone if you get this software installed on your phone, and it'll show you that capability is not set up for your phone. So my recommendation on this is going to be, I'm going to send out stuff to all the city employees, and I'm going to make some policy recommendations to clarify that we're not going to be grabbing people's personal information. That is already in our policy document. It says you do have an expectation of privacy, but I'm going to ask that we clarify that language a little bit more so people know specifically what's protected. So I don't know if you have any questions about any of this. Please ask if you do. Yes, sir.
So we have people, city employees, that receive city email on their private phone?
Yes, sir.
Are we meeting our requirements for state records?
Yes, sir.
Okay.
We cannot get your email off of your phone, but if it's city email, it's already come through the city's email server. Every piece of email that comes through there gets archived.
So use an example, if I send an email to Mr. Schultz and he gets it on his private phone, and I send it from my private computer, and we discuss city business, that doesn't get into the city system.
If either of the addresses that are involved are a Carson.org address, it does get into our system. If you have a private Yahoo account and you send it to someone's private Hotmail account, we don't get that.
Okay, but then the question becomes, are we meeting the state records law?
Yeah, that's something I can only offer you limited help with. If I think we do have a rule that says for city business you need to use a city email address. But if people skirt that rule, there's no way for us to archive that mail. Thank you.
Who's next? Nick? Good news.
Good afternoon. For the record, Nick Providenti. I guess we saved the best for last, right? So let's go ahead and get started. Basically what I did is we took numbers through June 30th. So these are unaudited numbers, and there's going to be a couple of revenues and expenses, for that matter, that we haven't gotten actual 12 months worth of revenue. I mean, sales tax, we've only gotten 10 months worth of revenue, and for all these other different types of revenues as well. So I'll go through these real quick. Property taxes were about 98% of budget. We'll collect a little bit more in June and July, or I'm sorry, in July and August. That'll pertain back to last fiscal year. So we'll probably end up about 99% of budget, and we'll actually get that 1%. It just might take us a year or two, just to, it's those stragglers that don't pay, and eventually they'll pay or we'll take their property. So typically they end up paying. So on licenses and permits, again, we've got about 2 months, or actually the last quarter for Nevada Energy and Southwest Gas aren't in as of June 30th. So those are pretty big numbers. And then we're also missing the last month of all the cable and all the telephone. It's just kind of a timing difference. So we're about 84%, which is about normal. Intergovernmental, that's where the C-tax numbers are. So, as of June 30th, we hadn't gotten the last 2 months. I know what those last 2 months are, and we're a little bit ahead of what we budgeted, what we estimated. We've gotten the last 2 months, and you might have seen that yesterday the numbers came out. The actual sales were a little bit down, but the collections were actually a little bit up. And that's kind of due to the out-of-state sales. The out-of-state sales, when those taxes get collected, they get dispersed via the population, not necessarily where the actual sale was in the county. So we get to piggyback a little bit of one. If somebody buys something out-of-state from Clark County, I think all the counties benefit from that. So it helps us a little bit. So that gives us a little bit of edge on the out-of-state sales. On the charges for services, we're about there. I don't believe I think what we have to do, the landfill is in that number. And I think, if I remember correctly, we bill on July 1st, and we still have to make some adjustments to move that billing because it was from June 30th. Fines and forfeits, again, miscellaneous, and transfers. The transfers, we just haven't made all the adjustments yet on that number. Again, total revenues, we're at about 92% total, but again, we still have quite a bit. We still have quite a bit of the 2 months worth. I did kind of a brief analytical review yesterday on where we're at with revenue-wise. There's not going to be any surprises one way or the other. We're not going to get a huge windfall, and we're going to be about what we estimated. On the expenditure side, we're at 95% now, so that's about $3.3 million below what we budgeted. And this was as of June 30th. There's still bills that came in, July and August, so we'll be a little bit better off. But it's not going to be anything, too crazy. We'll probably, I think last year we were probably about $1 million better than we estimated. I'm not sure we'll be at that number this year, but we'll know more in probably another month or so, because we're basically taking, the accrual period ends in August, so September and October we adjust right, before the auditors come. I just wanted to talk a little bit about some of the special revenues. RTC, streets, quality of life, V&T, special infrastructure. These amounts, again, are a little bit below budget. We don't have 2 months worth of, either gas taxes or the sales tax numbers. And we're also, there were quite a few dollars that we had budgeted for grants in these revenues, and we're still adjusting those amounts. So again, we don't see anything. We're going to be about what we estimate on these as well. There's no surprises on these. On some of the enterprise funds, the water enterprise fund, a little bit more on the user fees. We got about 2% more than we budgeted. The connection fees are up. Of course, it's not very much money. It's $24,000 versus $10,000. And then the operating expenses were a little bit down. Again, we're still adjusting. We still have that 2-month accrual period that we have to pay for things. And the the water fund and the sewer fund, I mean, they use a lot of electricity and those types of things, and we're still, in July and August, we still have to, we get those bills coming in from the prior fiscal years. So again, no surprises here. Sewer, again, the same, 101%, so 1% more than we thought. Connection fees, again, better than we thought, but, it's not a lot of money. And the operating expenses, about what we thought as well. And then the last one would be the building permits fund. We're doing quite a bit better, 143% of what we thought. And I think this is kind of what we estimated when we talked about the budgets. Basically, I think you authorized a few extra people. And, because of the increased user fees. But what you did is you changed the philosophy and hired Charles Abbott. So it'll be based on that percentage. But again, nothing out of the ordinary. So any questions?
Questions of Nick? Thank you, Nick. All right.
So Mayor, that concludes the report. Just to make sure you understand, the Health Department is included in Board of Health, which is why you don't see them presented in the quarterly review. And the Parks Department asked to be excused this time because Roger was on vacation. He wanted to be sure that he personally presented. So I just wanted to make sure you're aware of why those two weren't included.
Very good. All right. John?
Marina, I like this. I really like this. I printed it out and handed it out to people yesterday. So it's user-friendly.
Thank you.
All right. Anything else? Public comment. We're now on public comment on just this issue, not final public comment. I don't see any. Okay, then we'll now move on to item number 17. Nick, you want to take us through it? If we met all the criteria, debt management commission and all that stuff, so that the vote could be had or not had?
Yes, sir. Thank you for the record. Again, Nick Providenti, Finance Director. We're asking you to adopt the resolution of intent for proposing the issuance of and authorizing the publication of notices relating to the general obligation infrastructure sales tax bonds for the purpose of financing the infrastructure projects for the city. I do want to make one correction on the actual backup material. On the first page, after the first whereas, it says, whereas the Board of Supervisors of Carson City, Nevada proposes to issue up to $13,600,000 of general obligation limited tax infrastructure sales tax bonds. And then in parentheses, it has additionally secured by pledged water revenues. We need to take the word water out of there. They're just basically, they're going to be additionally secured by just pledged revenues. This has nothing to do with water. So we just want to make that correction. And again, Mayor, yes, the Debt Management Commission has authorized. They've done all they needed to do, and this gets the 90-day petition period started. So upon your action here, we'll go ahead and publish a notice in the paper on Sunday. That'll start the 90-day petition period, assuming that we don't have any petitions. After that, we can go ahead and issue and go ahead and start the process. And we anticipate getting the bonds first couple weeks of December. That's the plan right now.
Board comments, anybody?
I will have to disclose, so.
Good. Disclose now, so.
Okay. I want to disclose that I own a business, Adele's, that might financially benefit or be injured by the corridor project. And where the independence of judgment of a reasonable person in my situation on behalf of all the citizens of Carson City will not be materially affected by the possible risks or benefits the corridor projects might have upon my financial interest in Adele's. And if there are any financial risks or benefits to my interest in Adele's, they are no greater than that accruing to any other member of any general business, profession, occupation, or group that is affected by the matter, and therefore I can and will lawfully consider, participate, and vote in this matter pursuant to by NRS 281A.420.
Nick, or Jim, sorry.
Nick, I just had a question. I know you took out the word water, which is okay, but what are the additional revenues?
The additional revenues will be the 1/8 cent sales tax revenues that were just passed by the board that we'll start collecting on October 1st of 2014.
Resolution number is 2014 R25.
Public comment? Hearing none. Board, we're ready for motion. Motion by Supervisor Pankowski, go.
I move to adopt resolution number 2014-R-25, a resolution of intent proposing the issuance of and authorizing the publication of notices relating to general obligation limited tax infrastructure sales tax bonds additionally secured by pledged revenues for the purpose of financing infrastructure projects for the city, providing the manner, form, and contents of the notices, authorizing the city manager or city finance director to arrange for the sale of the bonds, providing other matters properly related thereto, and providing the effective date hereof.
Second.
Motion, couple seconds on the motion. Discussion?
Yes.
Discussion?
I just want to clarify, although I voted against this tax measure in the beginning, as we move through this process, as we go forward, I cannot continually say no to where this board has already directed our city and our community to go. So just clarifying my vote that I will be voting yea on this is in that fact, in that relationship.
On a motion, and further discussion? Hearing none, all in favor, signify by saying aye.
Aye.
Opposed, nay. Carried, unanimous. Thank you very much. Anything else to come before the board before we have public comment?
No, sir.
Public comment? Final concluding public comment? No. Hey, Neil, would you catch me after the meeting here just for a quick second? Thanks. Okay. Are we ready to adjourn? We're going to adjourn, and I think somebody's going to get some water thrown on, but
We have the ALS
city
challenge.
manager's asked for time to change, so we're adjourned.
Thanks, Mr. Mayor.